person more than I'm not a political, I do not belong to any political party, for a simple reason that you are obliged to follow the mandate of that party once you are in a specific position. So coming as an individual citizen, it will assist me to look and represent the communities or the people on the ground who are in a position to say, we are not here to pull off your stance, because in some cases, no offense meant, but some political parties, it's like, it's there to outlast the other. We've seen the coalition in Tshwane, where I come from. Irrespective of how good the program is, but because it came with Party A, it will never be allowed to shine. And people will be in a position where they would even go all out to jeopardize so that it be compromised. So I think for me, good governance is issue of accountability and also knowing that we are doing it for the people, not for individual gain. Thank you.
Thank you, Chairperson. My finger didn't want to turn the page. Ms. Motsepe, could you tell us what are the key issues affecting young people, their families and communities regarding drug and substance abuse? And how would you advise the government to deal with these issues?
The issues with young people, one is the issue of peer pressure. Two, it's unreasonable societal norms and values, and cultural impact. Remember, culture is not static, it's changing. So we are experiencing a situation where young people are caught in between, where the older generations are expecting them to behave this way, but they behave the other way around. And social problems that are available, it's one, the issue of the drug use as a result, some as a result of family dynamics. I had the opportunity to work in a shelter for the homeless people now during COVID. And when you talk to most of them, some of them went to the strip because of stepmothers and stepfathers. So we do not look into such issues. And it's not mainly about government, but it's a family thing. It's an internal thing. And what worsens the situation is the underpayment of social workers. You get a social worker, postgraduate, being paid 8,000. And how do you expect them to be dedicated and to do their job properly? Because even if when they do family reunification, you know, you'll just do it for the sake of doing it, and then you get the 8,000, you like it's for the 8,000, and then you get someone who doesn't have a degree, they are making it bigger than you. I know I indicated it's not about money, but what we're doing, we underplaying education. Education is very much underplayed. It's a problem where professionals end up also doing it for who cares? Because they don't care about me, why should I? A social worker has a postgraduate degree. A social scientist, someone with a BA social science degree, someone with an honors in psychology, sociology, whatever, they are sitting at home. We have in those shelters, we have people who are teachers, people who are university dropouts, others are university graduates. We have people who attempted suicide because they were not working. The family was expecting a lot from them, what we call black tax. And they were not afforded the opportunity. And remember the education system that we come from, where issue of entrepreneurship is something very new. So you go to school in order to be educated and to be employed by someone else. Okay, thank you.
Next question.
Thank you, Chairperson. Thank you, Chairperson. Yes, 5.2. Mrs. Mtsipe, in your opinion, what is the state of public rehabilitation center in the country? Are there any challenge with regard to the access of public rehabilitation centers in South Africa? If yes, what are those challenges? And how would you advise the country to address those challenges?
Thank you, ma'am. Public rehabilitations, there's lots and lots of challenges, but the main one is the waiting list. Because if somebody decides today that it takes from within, even if we can get you to a private one, but if the person is not ready to go for rehabilitation, it will not work. So if someone decides and they feel now, I've had enough of the drug or whatever, and I want to go for rehabilitation, and you're being put on waiting list for 8 months to a year, I mean, that will not solve. So they end up going back. They end up relapsing. There's a huge waiting list, and I think there's little number of public rehabilitation centers. And the available private ones are very much expensive. I know Sanka costs something like 34,000 for about 6 weeks, if I'm not mistaken. And how many families, even the middle income families, how many of us can afford that? And some medical aid would not even pay a portion of that. So the issue is the issue of access to rehabilitation centers. Secondly, capacitation of staff and recognition of professionals, like I indicated, social workers, especially in rehabilitation centers. We do have one that I know of in Hammanskraal. A social worker is paid 4,000 rand, and she is there because there's nowhere else to go. But how dedicated can one be? A facilitator is paid 3,500, a counselor is paid 3,500. That's a domestic worker salary, and that person has a degree. And you find people in government, people in municipalities, and you ask yourself, who in their rightful mind would write an advert and say, requirement is a degree, but then the payment is a domestic worker salary? What is that? So the problem is that the few elite up there thinking and believing that problems on the ground will remain problems on the ground. And we're not putting any efforts into assisting that. So until we recognize issues of staff component and increase the number of public rehabilitation centers, then we'll be able to. The other option is like the homeless shelters. If we use the likes of substitute therapies, like methadone, opioid, that will also assist, that also help, coupled with psychosocial well-beings. Families also, family reintegration through counseling sessions with families and all that, that will also assist in dealing with the issue of drug and substance abuse.
Thank you. I think one of the challenges facing the country is the lack of comprehensive national statistics on the prevalence of substance and drugs abuse. How can the CDA play a role in this regard?
The issue of statistics. There's a lot of research that's been done lately, but the problem is the research is done for, it's an academic thesis for shelving elsewhere. In most cases, research papers have recommendations. Those recommendations are never implemented yet. Are never implemented in most cases. What should or what could happen if I'm in that position, partnering with the local universities, because they also have a community engagement. Each university is expected to have a community engagement element. So if we partner with universities to say, through your community engagement department, we can do the same way as it was done with HIV/AIDS. Remember, VETS MRI as well. It's like now populated all over, and they provide stats more, and in comparison or in conjunction with Stats SA on some of the issues. So we can partner with universities and say, we need you to partner with us, we need to get statistics on this and that and that. So stakeholder engagement is very crucial. So if we partner with universities, for instance, I know Tekis University of Pretoria is dealing with a matter of drug and substance abuse. They have course upsides where they administer methadone, they have daily intakes of people who come and they may provide. So if funds are available, you can partner with them and other research institutions to say, let us see how we're working year to year or on a 3-year basis, and then we work on that.
Thank you, Chairperson. Ms. Motsepe, recently there has been much debate around the decriminalization of the use of cannabis or marijuana in South Africa by the courts. What is your opinion of this court judgment regarding the decriminalization of marijuana for personal use?
Thank you. I'm not against the decriminalization because we will not shy away from our history as a country and as a continent. Tobacco is as dangerous as marijuana, but because the Europeans came and made it a point that they make sales and whatever out of it, then it was legal. Cannabis has been used by great-grandmothers and everybody, not only in terms of smoking, but in terms of healing, cooking it, or putting ginger and whatever the concoction that they even recommend for COVID now. Some of it were used before by our great-grandmothers and they worked. So it's just that it was criminalized by colonization and those who were pushing for their economic emancipation. And I'm saying we cannot overlook or ignore our history. So for me, it was a good move.
Thanks a lot. During the COVID-19 pandemic, lockdown regulations were introduced, which led to the ban of alcohol and tobacco sales in the country. Now, how would you advise a country to deal with the sale of alcohol in particular during an epidemic in the future?
Sale of alcohol. I think this issue of, because it was never that much of a problem until COVID came in. So we are a very, must I say, rebellious nation. The more you say don't do that, the more we're gonna do. So if you let it open, but they comply to their licenses and all that, I think all that will work. The problem was the issue of being swamped, accident, or a hospital being swamped because of accidents and everything that's been happening based on alcohol related. But there's no scientific proof or a research that showed that alcohol contributed to a high number of that. It's just, for me, I believe it was just somebody's opinion and discussion from Eiffel Towers and not on the ground. Because decisions are made up there and they don't even know how the ground feels like. So for me, that would never make any difference as long as people know that drinking and driving is against the rule. The license holders know that they are selling from this point to that point and they've been working. And again, we should not shy away from our history. We have people who are educated because of alcohol or mkomboti sales. So once you close that, you are closing down a family's income. So for me, I'm saying we keep to the legislation, to the license requirements, and people will be held accountable for drink and driving, for being under consumption when you are not supposed to be. And that brings something up again from my side where I'm saying, I have seen people being hunted for drinking alcohol during COVID. But then people who are trafficking, there's no efforts that are pushed that much. If I'm being seen with a beer somewhere in the rural areas of Hammanskraal, I will be hunted and found. But someone who trades with children or women or stuff like that, it takes years to find that. So I think our priorities are not right. Thank you. How soon would you want, if I become the successful incumbent, how soon would you want the person to start, and what would be your conditions?
I guess the details of how soon will be more in the hands of the minister, because the committee is actually selecting to submit for minister's final appointment. And the HR issues and a number of other details get dealt with in there. And I cannot tell you exactly now how soon it will be. But from the committee point of view, the sooner the better. Because this committee that is there has been there for a long time now. Yeah. Yeah. Thank you. 2 minutes to hear your remarks. Don't have the CV of the oncoming interviewee. Yes, Honorable Sang.
I wanted to find out at this early stage from the support if the remarks that we are making are helping them in any way. The remarks, you know the remarks that we do at the bottom of the thing? If they are helping for the purpose of what we said they will do with it.
Okay.
Yes. So that we can, if we need to. So,
I would request that unless there's something very fundamental they want to comment on. All I'm saying, Honorable Sang, I understand what you want, but because so many of us made these comments, we're reluctant to put a shoulder on them to give remarks overall in a short space of time. But if there's something prominent they are worried about, they are free to raise them.
okay.
Does that address it?
No, this,
Okay, thank you. All right.
That's right, Dirlene James. Yes, good morning, Chair.
Based on us having invited you to serve yourself
Good morning, Ms. James. I'm Member Gillian, and I'm the co-chairperson of this committee.
Good morning. My name is Dikgang Stock, member of the Portfolio Committee, as well as this subcommittee. Thank you.
Good morning, Ms. James. My name is Bridget Masango. I'm the member of the Portfolio Committee on Social Development and a member of this subcommittee. Welcome.
Good morning to you, ma'am. I'm Letitia Aris. I'm a member of this committee, this portfolio.
Good morning, Ms. James. I'm Dalmaine Christians. I'm also a member of the Select Committee on Social Development as well as the subcommittee.
Good morning, my name is Otra Malika. I'm a member of the subcommittee.
Thank you very much, honorable members. The technical capables. Now we will shoot Ms. James. Between me and you, we've got 3 minutes. We've got only 3 minutes, our interaction. But I'll make sure that you get 2 minutes of it, 2 minutes plus. My apology, I beg your pardon. If you can tell us about yourself and why you are interested in committing your time and energy to the service of the CDA, and if you get appointed, what do you promise to contribute? Yes, press you can shoot.
Good morning, ladies and gentlemen. My name is Dideline James. I'm an anti-drug activist. I always introduce myself as a mum in recovery, recovering from being addicted to my son's addiction. I'm the mum who authored the letter to our then former president, Jacob Zuma, in 2013, when I found myself battling with substance abuse. I found myself knocking on many doors, the doors of the justice system, the doors of social development. People came up with all sorts of things. He was only 13 then, he's 24 now. I'm pleased to say, because of my activism, he's a recovered child. I continue to serve in my community and in Gauteng. I am passionate about this because I believe that if I serve, that means he stays cleaner for longer. I've realized the many loopholes and the gaps within the system. People said to me, just give him a good hiding and have him arrested, and that will bring about change. I beat him up. I had him arrested several times. I've stood with a knife against his throat. I called the cops in, paid them 500 Rand to beat him, and I thought that that would bring about the change, until I realized that I needed to let go and I needed to take care of myself and my family, and I needed to project wellness in my home. I was acting crazy, my son was acting crazy, and there was too much. I was addicted and he was addicted, and it was time that I pulled myself towards myself and realized that in order for me to bring change in my home and in my community, you can do it without a title. I'm very passionate about mobilizing communities and for mothers like myself to realize their power in getting their children back on track. Like I'm saying, 3 years ago he completed his matric. I go all over encouraging mums to get up. I encourage mums not to neglect their families. I understand that, you know what, going to social workers and saying you are late, ma'am, they don't understand that you had to look for this child early morning hours to bring him to your offices. I now know that you don't just send someone off to a rehab. I now know that you actually speak to the person. There's no blanket approach in approaching, in dealing with addiction in our country. I honestly wish that there will be more political will, that there will be more drive from the various departments. You go to one department and they say to you that this is social development's problem. Thank you.
Thanks, Ms. James. The Central Drug Authority was established by an Act of Parliament. Which act is that, and what does the act seek to achieve?
That is the Substance Abuse Act. That is the Substance Abuse Act, and I'm very confused and nervous, and I think that is Act 70 of 2008. I have gone through the Act, I have gone through the National Drug Master Plan over the years just to equip myself with some knowledge.
So what are you saying, ma'am? What are you saying?
I'm saying the Central Drug Authority is established according to the National Drug Master Plan and the Substance Abuse Act for treatment and prevention of substance abuse, 70 of 2008.
I have. If you, I just want the last part of the answer that speaks to what you think the Act seeks to achieve.
The Act basically seeks to achieve and to mobilize different departments and for us to strive towards a drug-free South Africa. For the various departments to realize and understand the roles of responsibilities, the various options to treatment, prevention, harm, demand, and supply reduction.
In your assessment, do you think that the CDA performs its mandate effectively or efficiently? If yes, how so? And if not, what are the shortcomings? And in your response, if you can highlight both with regards to its mandate as well as as in ensuring compliance, accountability, and monitoring development and implementation of the Department Drugs Master Plan by national departments and provincial drug master plans by provincial forums. How are you proposing to address these shortcomings? Thanks.
All right. In my personal experience, in terms of the shortcomings of the CDA, I think there's not enough awareness that this committee exists in terms of as well what its mandate is. I also think that there's a perfectly a written document, you know, which is the National Drug Master Plan that is not being implemented properly. I think that various government departments don't have a mini drug master plan that they are rolling out, and I think that also speaks to the fact that it's not part of their KPIs, and it's also a mandate that is not being funded at the moment. In terms of monitoring and evaluation, that is also another shortfall, because we are coming up with all these beautiful plans, but we are not sure of the actual numbers, the actual statistics out there, because the departments aren't providing feedback to the CDA. So I'm not sure if there's a current system in place that we can capture all the data. I think me coming on board, the number one thing that I would work on is basically a system where we can accumulate data, evidence-based research we can also do with the various departments and in the different communities. I think it's important to also stay connected to your local drug action committee, who is the closest to the communities, and right now we're not even able to tell how many local drug action communities there are. The local drug action committee, sorry, there is in various communities. There's no monitoring. Every time the administration changes within local government, you know, some of the MMCs will come up with a different strategy, yet the act is clear that one needs to establish local drug action committees. Also, even the provincial drug committees as well, there's no synergy between what is expected from the top and it's not being filtered down. There's no integrated approach. So number one, I think we need to address the approach and also find a way of monitoring and evaluating the different local drug action committees, and also having a tighter connection with your rehabs in terms of the numbers and what is the substance users, you know, how many is being admitted. I also think that partnerships with schools is also very, very important, a partnership with the Department of Education, because that's where it starts.
Thank you. The National Drug Master Plan 2019-2024 represent a multi-sectoral approach to create a South Africa free from harm associated with drug use, misuse, and abuse. The plan observes national and international policies, plans, and convention to ensure respect and dignity of all people. Now, my question to you is, if you are appointed as a board member, you will be expected to implement the authority's mandate. Just share with us your understanding of the objectives of the National Drug Master Plan 2019-2024 and how you think the CDA should achieve them.
One of the objectives, I think, speaks to active citizenship for us to mobilize society and to educate and empower society on the role they play towards eradicating substance abuse. It also speaks to the integrated approach, yes, between the various departments. It also speaks to supply reduction. Yeah, there's quite a few. I've gone blank now. So it's active citizenry, it's supply reduction, it's coming up with ways to prevent harm reduction strategies as well to implement for us to monitor. It is also to have the relevant resources on board, such as your social workers, in terms of also assisting and journeying with the substance abusers as well. From the time they go into rehab, making sure that there's aftercare, ensuring that there's reintegration.
Yes, Chair. Prior to the review of the National Drug Master Plan in 2013-2017, a need conduct to evaluate was prioritized to assess how it was implemented. Subsequently, the Department of Planning, Monitoring and Evaluation, commissioned by the Implementation Evaluation of the National Drug Master Plan 2013-2017 as part of the National Evaluation System in partnership with the GSD. The evaluation took place between August 2015 and January 2016. I want to find out from you what were the key findings and recommendations on the National Drug Master Plan 2013-2017 implementation and evaluation.
Remember correctly, was monitoring and evaluation that lacked. Also, the department and the roles and responsibilities of the various departments drafting the mini drug master plan. So that also wasn't there. The implementation basically of the entire drug master plan, and this is why we are reinforcing it in the current master plan. Thank you.
Thank you very much. I would like to find out what is your understanding of good governance, and then if it happens that you are appointed, ma'am, into the CDA board, how are you going to ensure that good governance is being practiced in the board? Thanks.
My understanding of good governance speaks to being ethical, having morals, being transparent, making sure that there is everything is above board, and making sure that everything is tied up to our policies and we do things according to the book and the Constitution. Yes, thank you.
Yeah, you were very fast speaker. We must keep up. Okay, so my question is, what are the key issues affecting young people, their families, as well as communities regarding substance abuse, and how would you advise government to deal with these issues?
Thank you so much for your question, ma'am. Where I come from, I think it's subcultural belief system. Young people are just trying to fit in all over. I think unemployment plays a huge role as well. Peer pressure, they don't know who they are. They're just falling for anything. I think we need to have more resources available for young people. I think we need to understand young people better, and instead of us enforcing programs down young people, we need to allow them to drive and to steer. I think what's important to us is maybe not important to them. Young people of today like music, they like dancing, and sometimes we're still coming with welding skills in communities where we assume that that's what they like. I think we need to open up conversations and dialogues. I don't think anyone wants to be a drug addict. Thank you.
Thank you, Chairperson. In your opinion, what is the state of public rehabilitation center in the country? Are there any challenges with regard to access to public rehabilitation centers in South Africa? If yes, what are those challenges, and how would you advise the country to address those challenges?
Thank you so much, ma'am. The challenges that I think we find having with the state challenges is lack of passion, lack of understanding. People still don't realize that addiction is a disease. It's the only disease that you get locked up for having the assessment process. They don't know how to assess the people in those places, that there's use, misuse, abuse, and dependency. I think everybody does things when it comes to addiction. This is how we were told to do things. This is what you have to do, instead of, allowing it to be a very personal journey. I also think that lack of funding for these places as well. Lack of funding, lack of understanding. I think what we would do is obviously, again, do enough training. I find that we have a lot of social workers that's fresh out of college, and they go into hard hit areas like Eldorado Park, like Westbury and Soweto, and they're not sure quite how to deal with it. I also think that we need to focus on the hardcore drugs, the drugs that actually destroy and cause chaos in your communities, like your TIC. We need to categorize the drugs as well, so that SAPS and your law enforcement agencies can focus on those drugs, the drugs that cause crime, stealing, killing, such as like your TIC.
Thank you. One of the challenges facing the country is the lack of a comprehensive national statistics on the prevalence of substance and drugs abuse. How can the CDA play a role in this regard?
Thank you for your question, ma'am. I thought about that earlier and that again speaks to a database that needs to be rolled out, by all departments, where it needs to have, your rehabilitation centers needs to have access to this database. Your schools also need to have access to this database. So whenever there's a learner that tests positive for substance, it needs to be recorded on the database. Currently, there's a lot of shame around addiction, so no school wants to be known as having 100 learners addicted to drugs, and we'll never have the proper stats if we don't create that type of awareness, and we don't encourage society and mums and families to step forward. So we need to lift the shame, have a lot of awareness campaigns in terms of lifting the shame, so that people are free to step forward, so that we can record those numbers, and so that it enables us to make informed decisions. Thank you, ma'am.
Thank you, Chairperson. Ms. James, what an honor to meet you. We've read about you and heard about you that time with the issues of Eldorado Park. My question to you are very simple. Recently, there has been much debate around the decriminalization of the use of cannabis or marijuana in South Africa by the courts. What is your opinion of the court judgment regarding the discrimination of marijuana for personal use?
Thank you for your question, ma'am. If we must start locking everyone up for smoking weed, we won't find employment for our young people. We need to look at restorative justice options instead of throwing everyone in jail. So I welcome the decision. At first, I was totally anti it, but now that I have a better understanding of substance abuse and how it sort of would play a negative role in the reintegration of someone who has gone to jail, they'll just continue using, they'll just continue self-destructing if not given a second opportunity. So we need to come up with restorative justice measures, you know, community service, and for people to understand, you know, and also not to infringe on people's human rights, because there are people who believe and there are people that can actually smoke it without it affecting the next person. I think it becomes an issue when your habit starts impacting the next person and society.
My final question to you, Ms. James. During the COVID-19 pandemic in our country, lockdown regulations were introduced which led to the ban of alcohol and tobacco sales in the country. How would you advise the country to deal with the sale of alcohol in particular during any epidemic in the future?
I think it was a good decision to do that because it gave us time as a country to reflect on actually seeing the outcomes and the abuse that many women had to endure during lockdown. But I think we can't just remove alcohol without giving people coping tools and mechanisms. One of the things that we should have done is actually equip people with the tools and mechanisms on how to deal with the withdrawal symptoms and what other offerings, and offer them that. Thank you. I have my understanding and basically what I read. I just like to have a clear understanding of this position, what it would entail. I know the book and on paper it says something. I want to know in terms of availability, also what is expected. Yes, sir. Okay. Okay.
Anything dramatically new from the one that made you to apply. Okay. Thank you very much.
if you're done talking.
Yes, oh, sorry for not. Uh, thank you, ma'am, for responding to our invitation to engage with us, to share, on an elaborate manner, share with us your competencies, your experience, so that we check it amongst others whether you can be nominated for appointment by the minister. We are going to ask you to feel free, relax, listen to yourself as you answer questions. Just to take this point to introduce myself, I'm Mondli Kungubele, the chair of the panel. Next member.
Good morning. My name is Marin Shekeli and I'm the co-chair of the committee.
Good morning. My name is Dikang Stock. I'm a member of the Portfolio Committee on Social Development, as well as this subcommittee. Thank you.
Good morning, ma'am. My name is Bridget Masango. I'm the member of the Portfolio Committee on Social Development and the member of this subcommittee. Thanks.
Morning, I'm Letitia Aris, member of the Portfolio Social Development.
Good morning, Ms. Kela. I'm Delmaine Christians. I'm a member of the Select Committee of Social Science and also a member of this.
Good morning, my name is Audrey Malika. I'm a member of the subcommittee.
Sabotage of this table. The sooner I leave this table, there are people who don't like this table. This is 7 number 12, eh? Thank you very much. Now we start, ma'am. The question I'm going to raise, between me and you, we'll have a conversation. for 3 minutes, but I'll take something far less than a minute so that 2 minutes plus is left for you. Use it intelligently. We want you to tell us why you think you took a decision to share part of your time and energy in serving CDA, and if get appointed, what are you going to do? It's your turn.
Thank you, Honorable Chair and members, for the introduction. As you've heard, my name is Nomathemba Kela, and I'm a social worker by profession, though I last practiced at grassroots level some 30 years ago, I'm sure. I would love to be in the CDA because it wouldn't be my first time in the CDA. I was a ministerial appointee of the CDA when I was a member of staff at the National Department as Chief Director for Social Welfare Services. And I was part of the design of the 2006 to 2011 National Drug Master Plan. I have worked extensively in the field of substance abuse, having been a director, firstly a social worker at grassroots level. And the situation then was bad, but it was not as bad as it is now. And I did some research in one of the rural communities then at Bethlehem in the Free State where I was working. And I asked young people to say, what is the biggest challenge that you have as young people in the community? And I thought they would mention things like poverty and what. They said to me, drugs. And that was like around 1992. And I asked them, why do you say drugs? And then they said to me, but we do dacha, we smoke dacha, and it's no longer a big issue. You guys used to smoke cigarettes in the toilet. The boys at the time used to smoke cigarettes in the toilets. Now we do dacha during break in the toilets. And the teachers join us. We do it together. So for me, it was a shocker, and it has been a passion of mine since then to say, but we need to make a difference. Having worked at the national and with the CDA at the time, yes, there were still gaps, and I think the new National Drug Master Plan is addressing some of the gaps that are there. But at the time we did the National Drug Master Plan, there were many challenges around, firstly, how it was structured, where it's located, the funding, the resources, or the resourcing of the National Drug Master Plan, and all those kinds of things, which I'm hoping that we'll get an opportunity to explore. Oh, is it 2 minutes? So I have to look at my watch, Chair. Oh, gee, I hadn't started, Chair, sorry. Do you want 1 minute? Okay, all right. Ziva.
Thank you. The Central Drug Authority was established by an Act of Parliament. So I would like you to let us know which act that is and what it is that it seeks to achieve.
Yeah. I think it was in the previous legislation on substance abuse, which was revised in 2008, and I took that legislation through Parliament at the time. So it's the Prevention and Treatment of Substance, Prevention of and Treatment for Substance Abuse Act of 2008. And what it seeks to do is to coordinate, to have a coordinated response on the substance abuse challenge in the country. It combines all the sectors. It tends to combine all the sectors, the departments, different government departments that have got a stake in the management of substance abuse or in the prevention of substance abuse or in the supply of, supply of drugs, the current distribution of drugs and whatever. So all those efforts needed to be coordinated, needed to have the departments account on what it is that they are doing, but also it seeks to establish provincial drug action committees, local drug action committees, so that the interventions, they start at grassroots level, or they filter down to grassroots level from the national department. So that's why it was established. Be brief.
In your assessment, do you think the CDA performs its mandate efficiently? If yes, how is it doing that? And if not, what are the shortcomings? And as you respond, if you can also highlight both with regards to its mandate and as well as in ensuring compliance, accountability, and monitoring development and implementation of the departmental drug master plans by national departments and provincial drug master plans by provincial forums. And also at the end, how are you proposing to address these shortcomings? Thanks.
Thank you. Definitely there are challenges. I don't think the CDA in the past has been as effective as it could have been. Firstly, it's where it's located. I am of the view that its location can pose a bit of a challenge, because if it were to be structured like, for instance, an organization like, or the entity like SANAC, where it has the power to let the departments account, and it's not accounting to, the departments don't have to account to their colleagues, to the other departments. There's a structure that allows it to ensure that there's accountability, and where other departments feel that they are, they have to. So it does have that kind of, if the SANAC has that kind of authority, which the CDA doesn't have. And secondly, the CDA doesn't have resources, money. Both at national level, there isn't a dedicated budget for the CDA. At a provincial level, in 2006, we managed to source funding for the operation of the provincial drug authority, of the provincial, provincial forums. But that dwindled. The money just faded. No one made, appealed for funding from Treasury to ensure that they are funded. So it's an unfunded mandate. And then also at a local level, the organization of the whole structure is still lacking. There is not much that is happening with like drug local committees, let alone where they should be located, being driven by the mayor and what have you. So there have been a lot of challenges around this, but also that even in the location of the provincial committees, it was supposed, maybe if it were located in the office of the premier, it could have, teeth. But at the moment, it's just within the department, and yeah, there are challenges in that area as well. Yeah, okay.
Thank you, Mayor. The National Drug Master Plan 2019-2024 represents the multi-sectoral approach to create South Africa free from the harms associated with drug use, misuse, and abuse. The plan observes national and international policies, plans, and conventions to ensure respect and dignity for all South Africans. My question to you is that if you are appointed as a member of the board, you will be expected to implement the authority's mandate. You will be expected to implement the authority's mandate. Just share with us your understanding of the objectives of the National Drug Master Plan for 2019-2024 and how you think the CDA should achieve them. Just share with us, please.
Thank you, ma'am. The National Drug Master Plan has got 9 goals, I think. And there are action plans outlined in those 9 goals. But I think what is critical is for the CDA itself to have its own strategy, to have a strategic plan in terms of how they are going to really ensure that all the other departments comply with whatever it is that they have committed to in their plans, to ensure that there are plans, the departments themselves come up with plans, plans that must then be integrated into the plan of the of the CDA. Secondly, I think it's going to be important that we have reporting mechanisms, not just in terms of numbers, because in the Drug Master Plan, if you look at the action plan, just in terms of the National Drug and the action plan in the National Drug Master Plan, they talk about numbers of this, numbers of that, number of these cases handled, or number of, but no one is talking about the impact of those interventions. And I think for me, what would be critical is for us to link whatever is there in the plans to research, so that there is a way of proper monitoring and evaluation of the activities. And the presidency there also plays a meaningful role. But also in terms of the reduction in the use of substances, we need to see over a 5 period that there are measurable outcomes. So I think it's going to be important for us to really make sure that we have a strategy of how we are going to manage this whole program. Secondly, to monitor the departments that will be, that have committed to, or that have been given the responsibility to manage the different areas that are outlined in the goals of the strategy. And thirdly, to ensure that there's research that goes with that, and also proper monitoring and evaluation systems that will then give us the sense of what we are achieving, what we are not achieving. And this would also inform the way forward in the next National Drug Master Plan, to say what are the challenges that we have, and should we address those challenges.
Yeah. 3.2, yeah. Yeah. 3.2, ma'am, prior to the review, you know that the Drug Master Plan was reviewed 2013-2017. A need to conduct an evaluation was prioritized to assess how it was implemented. Subsequently, the Department of Planning, Monitoring and Evaluation commissioned the implementation evaluation of the National Drug Master Plan 2013-2017 as part of the National Evaluation System in partnership with the Department of Social Development. This evaluation took place in August 2015 and in January 2016. What were the key findings and the recommendations of the National Drug Master Plan 2013 to 2017 implementation and evaluation? Yes.
There were a number of findings that were made by the monitoring and evaluation department in the presidency. One of them was the fact that there are no policy initiatives that give guidance on the proposed intervention strategy, like for instance, your supply reduction, demand reduction, and harm reduction strategies. Those have not been properly spelled out. So there's no policy trajectory around those issues. Secondly, I'm not doing them in that order, in the order in which they were done, but also that there needs to be, one of the recommendations was that, or one of the findings was that what I've already indicated about the location, the authority that the CDA has. The other issue that came through was the issue around the placement of the CDA. And this is one of the recommendations that came from the interministerial committee, that there should be an ask us. I was saying there's a recommendation that came through from the IMC that there needs to be a structure like SANAC, for instance. The other recommendation that came through from the National Drug Master is from the findings of the study that was done by monitoring and evaluation, was around the issue of funding, to say it's not properly resourced, and we need to look at the issue of resourcing of the CDA. And Treasury needs to play a bigger role in that. Yeah, that's what comes to mind. I think of it. I'm feeling pressured. Because of time.
Gunning for your question.
Okay. Thank you, Honorable Chairperson. Ms. Keller, what is your understanding of good governance? And then if it happens that you are appointed in the board of CDA, how are you going to ensure that good governance is being practiced in the board? Thanks.
Thank you, sir. For me, good governance, I think one of the guidelines that you follow in South Africa is the King 3 report on governance, that there has to be commitment, accountability, and proper management of the organization, its resources, and its programs. And for me, those are some of the key things that we need to be looking at as a CDA. The King 3 made certain recommendations, for instance, around the structure of any board. For example, that there has to be committees, the finance committee, but unfortunately, because of the way the CDA is structured, it has not happened in the past that you have those committees that drive the processes in the CDA. But also one of the areas is the issue of ethical conduct, your ethical responsibilities as part of your government, that you are a member in good standing, that there's no corruption, you conduct yourself in a professional way at all times, and you make sure that you act in the best interest of the department that you're accounting to, that you manage its resources appropriately, and that you plan, but also you show results in what.
Thank you, Chairperson. The next question is, what are the key issues affecting young people, their families and communities regarding drug and substance abuse? And how would you advise the government to deal with these issues?
For me, I think our young people in the country are at a crossroads now. There are a lot of factors that work against them. We've got the issue of poverty, inequality, and unemployment that afflicts young people. And you cannot address the drug problem outside of the poverty of issues around poverty. Even now, when you look, most of the people that are doing drugs are in the townships. Bunyaupe and what have you, they're all in the townships. And there are people that are using other drugs, more sophisticated drugs, with people that have got money and so on. But the critical thing with youth is that at the moment, there are a lot of young people that should be in schools, that should be having jobs, they should be empowered, you know, that don't have information, even information around substance abuse. Unfortunately, I don't have time, so I would have given a proper illustration of something that did the rounds just recently. So, yeah, with that. Where young people, college students, were drinking from bottle to passing the bottles around themselves. That actually tells you that if prevention strategies that you are using are not working, the information, education, we don't give information and education, and you ask yourself whether they understand the harmful effects of substances. They don't understand, I don't think they do. And also the family relationships, where you have a myriad of problems within families, the gender-based violence and what have you. There's no outlet for young people, and they find solace in drugs. They find, you know, with their peers. But also that's a big problem with peer pressure as well, drug use in schools and so on. I think there has to be a youth strategy that incorporates all the service, everybody that has to do with youth programs, that it's an integrated strategy across the country and across sectors, whether it's NGOs, whether it's government, in schools and what have you. So the programs that we need for youth are very specific and can cover all the aspects relating to sure.
Thank you, Chairperson. I want to check, in your opinion, what is the state of public rehabilitation centers in the country? Are there any challenges with regard to access to public rehabilitation centers in South Africa? If yes, what are those challenges, and how would you advise the country to address those challenges?
One of the challenges facing the country is the lack of comprehensive national statistics on the prevalence of substance and drug abuse. How can the CDA play a role in this regard?
Thank you, Chairperson. Ms. Keller, um, recently there has been much debate around the decriminalization of the use of cannabis in South Africa by the courts. What is your opinion of the court judgment regarding the decriminalization of marijuana for personal use?
I think there are pros and cons around that. The, if you look at it's cannabis and its benefits, you know, for instance, you can use it in the place of the drug that they use for pain and what have you. So there are medicinal uses for cannabis, in my view. That's my personal opinion. But also, it's an entry-level drug. People start using other drugs before they use they use more sophisticated drug. They start using. So it's an entry drugs for drug users. But my other view is, and therefore in that case it is a bit of a risk. But my other view is that you can't codeine. It's used for drug use. It can be abused like any other over-the-counter drug. It can be abused. Does it mean that you are going to ban all those drugs? I think for me the critical thing is demand reduction, enabling people to understand the use of drugs, the impact that it has, and also how then they can refrain from using their drug. For me, that's the most critical thing.
Thank you. During the COVID-19 pandemic, lockdown regulations were introduced, which led to the ban of alcohol and tobacco sales in the country. How would you advise the country to deal with the sale of alcohol in particular during an epidemic in the future?
I think I would support the response that government had, because it also taught us a few things that people can do without substances. The alcohol ban was a plus for me, even though it had its own negative, or maybe the implications were not so good in some cases for families, because the people that drink mostly are men, and there was abuse and what have you, because people were frustrated. But for me, I think it's important that when there is a crisis, we want to first save lives. This was in line with the Disaster Management Act. We had to face lives, because I still think that had those interventions not been put in place, then we would have had higher mortalities in the country due to COVID. So I would support that, and if there is a need to do that, we don't want to be a police state where we manage to control everything. But I think that at that time it was necessary and it was required, and it had a very good effect, in spite of the fact, of course, that the illicit and traditional brews also yeah, were used. I don't think it would make sense to ban alcohol. And I'm sure, Chair, you'll agree. And you can't be banning everything, you know, but you need to, like say, again, manage the demand, ensure that people drink responsibly. You know, I can't believe I'm saying this, but yeah.
Thank you, Ms. Keller. Thank you. We expect it, ma'am, as soon as possible, although that is going to be in the hands of the minister, because the committee simply nominates and the minister appoints. You know that in the Bible, they said God plans, say we plan, God decide. But that's not the analogy. Don't take it that way. The authority of the committee is very, very important with regard to what it submits to the minister. But at the end of the day, that is within the purview of the minister. But we expect her to do it as quick as possible, because these appointments are long overdue. Thank you very much. Yeah.
Thank you, members.
We're supposed to be moving to Ms. Khoza. Now the time is, so what is your view? Is the lunch here? Is it here? So can we go for Mayatula? Honorable members, do you need a break? Is she not allowed? Who is here? There's no one. So, in other words, we are bound to come back at 2. Is anyone available?
Of the 3 asked candidates?
Yes. So, we just have to wait for 2 o'clock.
For 1 or 1:30, it was a rescheduled lunch for 12:30, and then they are landing at 12, so they will be here around about 12:30 in town. As soon as they come here,
Should we start at 1:30?
no, 12:30 to 1.
Let's start. Let's come back at, what time is it now?
10 to 12.
10 to 12.
The lunch is after 12:30.
Let's come back at 1. Can we do that? Or 1:30?
12:30, yes, take lunch.
No, Mauti 12 kufika lunch. We can't start interviews at 12.
At 1.
So that's what I'm saying. I'm calculating. And understand. Uti lunch if you are 12. It means between 12 and 1 we've got lunch. Yes. Is that okay? Yes. The least we can do, let's start at 1:15. Okay. Is that okay? 1:15. 1:15. 1:15, then 13:15. Nazo ke into zenu. 7, 17, 20, 4, 29, 37, 43, 49, 56, 60, 64. Right? Nanzo, nazo into zenu majazi. Mondli. Nazo. Nansi CV yakhe naye mayihambe. Mayihambe hiyo.
Yes.
And when you're done with the mic,
Yes.
every time you respond, you switch it on.
Yes.
And when you're done,
No as the state, no as the state omtebegen. Ja. De kandidaat is hier zo. Good afternoon, Miss Maya Tula Nyamega Nandi. Sure. Okay. May I take in this panel interview to have exchanges with you with regard to what you can, how you can sell yourself. All we request is a relaxed candidate, confident candidate, a candidate who listens to her articulation. That's all. There is no danger here. These people, I'm trying to check, all of them, they seem to be belonging to a particular religion. But I only hope that there are no millions that are being stolen. My name is Mondli Kungubele, the chair of the panel. Yes.
Good afternoon, Ms. Kosa. My name is Merenshe Kilian. I'm the co-chair of the committee.
Good afternoon, Ms. Kosa. My name is Dikang Stock, member of the Portfolio Committee on Social Development, as well as this subcommittee. Thank you.
Good afternoon, Honorable Member.
Good afternoon, Ms. Maya Tula Koza. My name is Bridget Masango. I am the member of the Portfolio Committee on Social Development and this subcommittee. Welcome.
Honorable Member, thank you.
Good afternoon, lady. I'm Letitia Aris, member of the Portfolio Committee on Social Development.
Good afternoon, Honorable Member, thank you.
Good afternoon, I'm Delmaine Christians. I'm also a member of this committee.
Good afternoon, my name is Otra Malika. I'm a member of the subcommittee.
Thank you, Honorable Member. Good afternoon.
Thank you very much. I have introduced yourself, and I called you Ms. Maya Tula. Thank you very much. All right. Well, remember, we need to kick to the goals. Ms. Maya Tula, now we're going to start engaging with you. The first question that I'm going to raise with you, it takes 3 minutes of engagement between myself and yourself. But I always try to take seconds so that 2 minutes point something belongs to you, and I don't interfere on that one. It doesn't mean I'm not entitled to interfere. If you can tell us a bit about yourself and why you chose to commit yourselves to do this job, put your energy aside to serve this board. And indeed, if we allow you to do this job, what are you bringing?
Honorable Chair, I hope I'm audible. Is that fine? Okay. I can take it off. Okay. Thank you so much, Honorable Chair and honorable members, and I think also the officials at the back. As the chair has indicated, my name is Nyameka Nandi Mayatula Koza. I come from Johannesburg, in the south of Johannesburg, and I'm the second child in my family. We are 3 in total. I'm married with 4 children. I was born and bred in Soweto, and I went to my primary education and secondary education in Soweto, Ngube Secondary High. But like many other young people in 1977, after 1976 uprisings, had to, forced to leave the country. Spent 10 years outside of the country, but also being engaged, keeping in touch with the underground movement of the time. Came back in 1987 because both my parents passed on, so one had to come and take care of the home. I was then also involved in the structures of People's Power, your Sanko and other structures. And because of that activism, I think the party ANC saw potential in deploying me together with the other people in serving a government. Started in Soweto as the mayor in Soweto. From there, deployed into Greater Johannesburg Metro Council as the speaker of council there. And thereafter joined the mayoral committee under Mayor Masondo, who's now the chair of the NCOP, and thereafter was deployed to the provincial government. So all along, I think the passion and the work that I've been doing was inclined towards social development, right from being in Soweto, working with the people, the women in particular, and young people, assisting them in terms of employment creation, whilst holding the executive accountable to the people through community participation programs. So even with the city of Johannesburg, I was deployed in social and community development, and I then, gained interest on the work that we are here about today. We did a lot of work in terms of substance, control of substance abuse, assisting young people who were using and abusing alcohol in the main, and drugs, various forms of drugs. My time is up. Okay. The next question, why am I? Oh.
May I please? Yes. Thanks, Chair. The next question has to do with the Central Drug Authority having been established by an Act of Parliament, to ask which act that is and what does it seek to achieve, please. Thanks.
Thank you very much, Honorable Member. Indeed, the Central Drug Authority has been created by the Act, which is the Prevention of and Treatment for Substance Abuse. This is an Act of 2008, Act number 70. So that Act basically creates the CDA, and the CDA is a statutory body. It's a multi-sectoral body, which involves quite a number of departments of government at national level, but also involves the provincial level, as well as the local level, where we have the local drug action committees. So it's a multi-sectoral advisory structure. And the CDA basically reports to the parliament, and it also reports to the executive, but through the minister. And the role of the CDA basically is to develop what we call the National Drug Master Plan. And also to ensure its implementation, as well as to ensure its monitoring and evaluation, yes? As well as, giving strategic advice, to the minister and all the other principals in terms of how we control drug abuse in the country, because it has become epidemic. There's quite a number of young people. We read that not even only young people, but older people, 20% of the population of this country is engaged in drug use or drug abuse. But CDA also facilitates and encourages and coordinates the strategic projects, because I did say that it's a multi-sectoral statutory body, so it has to coordinate. It also has to ensure that the resources that are used optimally and rationally for it to do its work. And it has to ensure that all these structures, the departments and the other government agencies, have plans in place that are informed by the plan, the National Drug Master Plan, and that there are performance indicators as well, so that it's easy for CDA to monitor and evaluate performance in terms of control of use and abuse of drugs in our country. And it's important also for the CDA to have summits. And I'm informed that there must be 2 summits in a particular term of office of 5 years, called biannual summit, where they interact with all these stakeholders, to check if indeed work is being done to control abuse and use of drugs in our country, and then also strategize further in terms of how can we improve this particular work. The CDA must report to Parliament. It must report to the executive on the work that they are doing at a specified time frame. It can't afford to report very, very late. So annually it has to report. And the CDA is also responsible to ensure that we implement strategies that are in the Act itself. Strategies of prevention of drugs in our communities. Also, engaging on early detection. If there's somebody who is detected to be starting to use drugs, so something has to be done by these stakeholders that I spoke about. The issue of treatment is also very, very important. Psychosocial treatment, health treatment of the people who are abusing drugs. But most importantly for me is the aftercare of the people who have been treated, as well as reintegration into the community, because what is the use of them getting treated only to go back to the community that's infested with drug lords, etc. Hence also the importance of law enforcement. Thank you, Chair. From what I have read, in terms of the reports of the CDA to Parliament, firstly, it's that almost successive years, they've not been, presenting reports on time. So it's something that needs to be solved, but you can't blame them only. They also have to ensure that, the provincial forums, as well as the provincial departments, but also the national departments, do what they are expected to do, report on time. I'm told the CDA should report to Parliament by September of each year, and the stakeholders should report to CDA by June of each year. But most of the time, this is not the case. So it's important for CDA to be authoritative, not in a negative sense, but to ensure that, everybody reports on time. And I think that they have tried their level best also looking at the National Drug Master Plan. They've tried to look at the challenges because there was an evaluation, I'm told. There was an evaluation that was done by the Department of Planning and Monitoring in the presidency, and there were a few challenges that were identified, and the CDA was able, when they were reviewing, because that's their mandate as well, is to review the National Drug Master Plan every 5 years and make recommendations to Parliament as well as to the executive. So the first thing that they, in terms of their mandate, they discovered that in fact they have not been evidence-based, right? They have not been, looking at the outcomes of the researches that are done by various medical councils and other structures, so that the plan itself responds, to the evidence that would have been found. So if you look at the National Drug Master Plan, it has shifted a bit to respond to the evidence that they have been receiving, and also responding, having consulted even the people who are abusing, abusing drugs. They have listened to them, and hence some of the strategies that they've come up with respond, to the needs of the users and abusers of drugs. So I believe that now that the National Drug Master Plan is evidence-based, and it's also balanced in a way, and it's looking at the integrated approach, because in the past, probably there was a dominance in terms of law enforcement. And we have seen that law enforcement hasn't really assisted the country in solving the problem of drugs. So I think the CDA has also realized that when somebody abuses drugs, that person, it's not because of moral failure of that person. It's because of the problems of the nation, the problems of the country, problems of unemployment, of problems of inequality, problems of the triple challenges is unemployment, is inequality, and the other one, it seems to escape my mind. It's because of those problems. So it's imperative that we don't think that they are the problem. They are not the problem. So it's important for CDA, to focus on their health, to focus also on the safety in the communities, to take into consideration that these drugs that people take, they actually alter the brain of a person. And the person doesn't behave as a normal person because the brain is altered, the central nervous system is altered. These people are no longer themselves. So we can't punish them. The thing of taking people to jail and punishing them because they are carrying yaupe, they are caught with nicotine, or they're abusing alcohol, it doesn't help. So we have to focus rather on the evidence-based approach, but also integrate all the programs of the stakeholders to ensure that together we are able to combat the problem. The CDA also has seen the importance of ensuring that those who are involved in crafting the National Drug Master Plan also get involved in implementing it, because I think in the past they will be involved in crafting it, but when it comes to implementing it and monitoring it and evaluating it, they were not there. So the impact has been very, very little. Hence, the impact of drugs impact our communities in terms of health, of the people, in terms of even the economy. I'm informed that government spends about 280 billion rands, over 280,000 billion rands from the GDP to address the problem of drugs in our country. So with this integrated approach, we think that the CDA will basically go somewhere. Also being informed by the policies and the laws of this country, the constitution, the national development plan of the country, but also being informed by the other policies from the health department, the health policies, as well as the anti-drug, anti-gangsterism policies, as well as various other strategies, including the national strategy that deals with issues of HIV and AIDS, because you can't separate these social challenges, they go together. People who take drugs are susceptible to, to getting all sorts of illnesses, HIV, and other, sexually transmitted diseases, etc. So just repeat the last part of your question, sorry. The shortcomings. I've spoken about the lateness in terms of the report, and the other problem probably would be issues of accountability of the leaders and the members, and probably self-serving. So there's a need for for CDA to look at those issues to ensure that the accountability, people are held accountable. Those who are members, they are held accountable, and that the principals must be informed. In fact, in the first instance, the principals, it could be heads of departments in the provinces, premiers themselves in the provinces, the ministers, because there's quite a number of departments that are involved. So all the principals must be informed, they must be aware of the National Drug Master Plan and the existence of CDA in their mandate. And when the people responsible are not...
Thank you, Ms. Maratula. Question 3. Da baby einde. Huh? Oh.
Mrs. Koza, the National Development, the National Drug Master Plan. Can you hear me? The National Drug Master Plan represents a multi-sectoral approach to create a South Africa free from the harm associated with drug use, misuse, and abuse. The plan observes national and international policies, plans, and conventions to ensure respect and dignity for all people in South Africa. My question to you is, if you are appointed as a board member, you will be expected to implement the authority's mandate. Share with us your understanding of the objectives of the National Drug Master Plan 2019 to 2024 and how you think the CDA should achieve them.
Thank you very much, Honorable Member. Indeed, the CDA is the administrative unit of the National Drug Master Plan. So they are responsible, working together with the stakeholders to ensure that the National Drug Master Plan is actually implemented. This is a plan that is really having the strategies. It's a single document with all the strategies from various sectors put into one so that we respond as a country to the substance abuse problem, as well as to the United Nations conventions that we have signed as a country. So the objectives of this plan, maybe firstly beginning with what we want to achieve with the plan. We want a South Africa that's free of drug abuse, right? But how do we do that? Earlier on I spoke about the need for evidence-based approaches. So as we, aim towards implementing this particular plan, we need to embrace a balanced and integrated approach when we deal with the issue of drugs in our community. We need to ensure that our communities are safe. This is what we want to achieve, because without safe communities, we can't have young people and other people who without safe communities, we'll have young people and other people who actually abuse and use drugs. So it's important for the country, the government, to invest in safe communities, but also to control the supply and demand of drugs. As long as there is a demand, there'll always be a supply. So it's important for CDA to look at the strategies to control demand and supply, but also in this country, we have a situation whereby we do have drugs that are medicinal, that are therapeutic. In fact, very recently, the court made a decision in terms of cannabis, that it can be used for medicinal use, and, but that needs to be controlled, and people need to know exactly, you know, how that is going to be done, because they can't use it in public, they can only, you know, use it in their own homes for medicinal use. So it's important for NDA to control that situation, but also there is an emergence of new drugs. You know, Nyawupe, the concoction of quite a number of things that are dangerous, you know, so it has to be controlled as well by the NDA. So the other, sorry, the CDA, sorry, I don't know why NDA is on my mind. So other objectives for the CDA basically is to, okay, I spoke about reduction of demand, and that can be done through prevention as well as treatment, okay? There's quite a number of prevention strategies. It could be education of communities, education of learners at school from primary education upwards, also at tertiary education as well, to create awareness about the dangers of drugs, illicit drugs in our communities. Treatment as well, I think I spoke earlier about treatment, but the NDA also needs to ensure reduction of supply, and this can't just be done by one sector. It's a multi-sectoral approach where everybody must have strategies and plans and indicators in place to work together. So South Africa no longer wants to see silo mentality, departments working alone and wanting to achieve alone, because it doesn't help the nation. The problem is exacerbated. But also the NDA is to ensure that when they receive funding from Treasury, that funding, that money, the resources must be used in a rational manner. It must be used optimally so that the money is not used, but it benefits the communities that are affected by drugs. What is also important for CDA is promotion of good governance. I think I've made reference on good governance, good corporate governance, promotion of leadership. People must take responsibility and accountability for the work that has to be done. And CDA must therefore coordinate those leaders whose responsibility is to deal with the epidemic of drugs in our country. The CDA must also ensure that, because this is one of the challenges that I read about, the data that is collected, from the sectors, we need to ensure that the data is authentic, and that there is research, and that the research is also, evidence-based, so that whatever outcome that comes from the research, CDA is able to take that into consideration. I also read about a clearinghouse. There must be a clearinghouse where reports are received from various sectors. CDA should be able to check those reports and ensure that they are authentic, and that those reports have also been approved by the heads of departments, by the ministers, and by the DG himself or herself. And if the data that is collected deviates from the plan, because we now have one plan to control use and abuse of drugs in the country. So no sector should just do their own thing. They must look at what the plan says, and they must have their own indicators that are in line with the plan and implement together with all the other sectors. It's important also for CDA to conduct surveys and surveillance, just to check that there is impact, because it's no use to implement the National Drug Master Plan and yet you don't see any positive impact. And I must say, over the years, yes, good work was done, but as I have indicated, a lot more people, because of the triple challenges, are actually abusing drugs in our country. Yeah, so that those are the objectives of the CDA. Thank you, Chair.
Okay. Yes. Okay. Prior to the review of the National Drug Master Plan 2013 to 17, a need to conduct an evaluation was prioritized to assess how it was implemented. Subsequently, the Department of Planning and Monitoring and Evaluation commissions the implementation evaluation of the National Drug Master Plan. 2013 to 2017, as part of the National Evaluation System, in partnership with the Department of Social Development. This evaluation took place between August 2015 and January 2016. If you can tell us what were the key findings and recommendations on the National Drug Master Plan for 2013-2017 till 2017, the implementation evaluation.
Should I respond, Chair? Yes. Thank you very much. I think I've alluded to some of the findings of the evaluation by the Department of Planning and Monitoring in the presidency. I think the first major issue, excuse me, was the issue of unclear policies. So the current National Drug Master Plan is clearer in terms of policies. How do we reduce demand? How do we reduce supply? And not a lot of emphasis on reduction, on harm reduction, and not a lot of emphasis on punishing people, but a lot of emphasis really on development, especially poor communities, especially rural villages as well. So that has been the policy shift that the CDA found out from the evaluation of the 2017 master plan. But also I made reference to the lack of evidence-based approach, which the National Master Plan is now addressing. And CDA will be working with those organizations that do research from time to time and make good use of what is coming out of the research. It was also found out that, I think I've made reference to the fact that not all stakeholders, the sectors were taking the work of CDA seriously. And therefore that made CDA also to look bad. So the National Drug Master Plan is now, ensuring that CDA, is authoritative in terms of what needs to be done by the other sectors that are supposed to assist in terms of implementation of the plan. And the other challenges that were identified was basically the increase of usage of especially what is called the design, the design drugs in Yaupe, in Gauteng, Wunga, in KwaZulu-Natal, and that CDA and the sectors do not seem to know how to manage, how to control that situation and be able to distinguish between those drugs that are used for medicine and the drugs that are basically illicit in the country. And I spoke about the information that will be submitted. I learned that the committees would not be happy when they read the reports of the CDA. There was no template, so it was just haphazard, unorganized reporting. So now that there is a clear national drug master plan, which also has an implementation plan, I learned that there was no implementation plan. Thank you, Chair.
Yes, thank you very much, Honorable Chairperson. Ms. Mayatula Koza, please share with us your understanding in terms of what is the key features of good governance, and then also if it happens that you are appointed into the board, how are you going to ensure that good governance is being practiced by the board? Thanks.
The key features of good governance is basically about responsibility and accountability of members. Members of the CDA who do what is expected of them to do, members who don't do things for personal benefit, but who do work in order to benefit the public. So for me, that is good governance. And I think I made reference to accountability as well. Good governance is about, having strategic direction. We must know what the CDA is up to in terms of strategic direction, which for me, fortunately, it's there, with the 2024 National Drug Master Plan. And good governance is also about reporting timeously on the work that you are mandated to do. Because if you report outside the timelines, I don't think that it is basically a good governance. And good governance is about not abusing your positions for personal gain. It is important for CDA to have in place things like, conflict of interest policies, because according to the business judgment rule, the members of the CDA should not have conflict of interest. Otherwise, that's not good governance. Members of the CDA should have an understanding of the mandate of the CDA, because if they don't, then that is a problem. It's not good governance. And where there are conflicts, those conflicts should be managed properly. But CDA must also have an ethics policy so that the members of the CDA and the sectors, act ethically, with integrity, with honesty, with all the positive values that are enshrined in our constitution. Principles also of equality and etc. So those are some of the. Thank you, Chair.
Thank you, Chairperson. The next question. What are the key issues affecting young people, families and communities regarding drug substance abuse? How would you advise the government to deal with these issues?
Press. Thank you very much, honorable member. The challenges facing young people today is indeed challenges of unemployment. Our country has about 30% unemployment, probably a bit more. But if you look at the young people, they are the most affected in terms of unemployment. Hence, they idle. And an idling mind is a dangerous mind. When they idle, then they think of engaging in abuse of drugs. Young people also suffer from poverty. And obviously, when young people suffer from poverty, they would want to go out, and they call it panda, to go out and find resources for themselves. And the lack of sports, activities in the communities, the lack of arts, culture, heritage in the communities. Young people also want to engage in those kinds of programs, but many communities in the rural areas, in some of the townships, we don't have adequate sporting fields for young people to engage in, etc. But we've also seen young people who drop out of school and therefore do not pursue their education. So many young people are actually unemployable, so they need to be assisted in terms of skills. We have TVET colleges in our country, and they should be assisted and supported to get into those spaces and acquire skills so that they can actually be employable. So I think amongst the people who really use and abuse drugs, in the main, it's young people. And they're found in the treatment centers. But again, once they're out of the treatment centers, the question is, what happens in terms of their reintegration in community? They go back to the same drug lords that are in the community. Hence, I indicated earlier that it's important also for the security cluster or the law enforcers to deal with the problem. Young people are also suffering from various illnesses as well. And then it's important also for CDA not only to look at the drug abuse, but it's important to look at the aspects of HIV, the aspects of TB, the aspects of other communicable diseases that young people can actually be assisted to deal with. The other health problems that emanate from drug abuse, In fact, the drugs will affect the whole body. It will affect the liver of a young person. It will affect the kidneys. It will affect the brain. It will affect the nervous system. It will affect the respiratory system. It will actually diminish the young person's immune system. And at the same time, they don't have access to medical aid. So they have to go to the public hospitals, most of whom are good, but some of them really lack some of the resources that are needed to assist the young people. There is a problem also of once young people are engaged. Thank you, Chair.
Thank you very much.
Thank you, Chairperson. Ms. Mayatule Koza, in your opinion, what is the state of public rehabilitation centers in the country? Are there any challenges with regard to access to public rehabilitation centers in South Africa? If yes, what are those challenges and how would you advise the country to address those challenges?
Thank you very much, Honorable Member. I'm aware that in each and every province, at least there must be one government-managed rehabilitation center for the people, especially for the people who cannot afford to go to the private rehabilitation centers. Yes, we do have private rehabilitation centers. We have inpatient treatment centers, which are public, as well as outpatient treatment centers. The government treatment centers are mostly inpatient. So the users will stay there for 6 weeks, and thereafter they would have to go and be part of the aftercare and reintegration programs. I learned that the government rehabilitation center in the Free State has taken too long to be completed, but I'm not too sure as we speak where the process is. So it's important that it doesn't take too long when these rehabs are built. They are built on time within the given resources, and that they are actually effective and efficient in terms of addressing and controlling the use and abuse of drugs. Some of the challenges, when I was in social development, I would begin with the identification of the people who are using and abusing drugs from El Dorado Park, from the city center, from Hillbrow, from Soshanguve, Mabopane, and assist them to get into the rehabilitation centers. Sometimes they are full, these rehabilitation centers, so there's not enough beds, and sometimes there are no skills development programs there. So some of them just look at the medication side of treatment, whereas it should be psychosocial, it should also be developmental, so that when they come out of the treatment centers, they are able to, even have their own businesses or be employable, so that they don't relapse and they don't go back to the same situation that they found themselves in. And so I think those are the challenges that are there. Yes, the overcrowding and stuff.
Yes. Thank you very much. One of the challenges facing the country is the lack of comprehensive national statistics on the prevalence of substance and drug abuse. How can the CDA play a role in this regard?
Indeed, there is a lack of comprehensive nationally representative statistics in the country. I have come across a situation whereby Sakendu, which is one of the organs that research, but they would mostly go for rehabilitation centers and do their research in terms of the users who are in the rehabilitation center. So and not all rehabilitation centers. So it wouldn't be representative of the country so that we know exactly where we stand as a country in terms of drug use, abuse, as well as in terms of control, the impact, to know exactly where we are. So it's important for CDA to work with these structures, medical epidemiology structures, to ensure that a nationwide research, nationwide surveys are actually done so that we have a national picture, representative findings of you know, the extent of drug use and abuse in the country as a whole, and therefore also be able to come up with effective strategies and plans to combat the challenges themselves. If you could just repeat the last question. Oh, okay. So, oh, are we done, Chair? Okay. So yes, as I've indicated, Honorable Member, we need a representative statistics so that we know exactly the extent of the problem and therefore the correct strategies to combat drug use in our country. We also need, I've spoken to the National Clearinghouse as well, that all the evidence that we gather, all the reports that we gather, they are checked by the CDA, and if there's any deviation, CDA should be able to correct that particular deviation. There is a need for national surveys as well, national representative surveillances, so that we don't only look at, you know, a particular province or a particular sample of people, but we look broadly at a representative sample of this particular work.
Ms. Kosa. Thank you, Ms. Kosa. Recently, there has been much debate around the decriminalization of the use of cannabis in South Africa by the courts. What is your opinion of the court judgment regarding the decriminalization of marijuana for personal use?
Thank you very much. I'm going to be honest with you because I'm going to be honest, Chairperson, because we actually protested before the judgment. We were part of those who were protesting against those who were calling for decriminalization of marijuana in our country. Why? Because we had engaged those people who are in the treatment centers and other people in the communities to get their views about what was about to happen in our country, and many of these young people indicated that, you know, they start using marijuana, right? But as Africans, we all know that marijuana is also a herb, right? But they mix marijuana with mandrax. Mandrax is illicit and it's dangerous. They mix marijuana with cocaine, and the levels, they increase the levels up until such time that they use, very, very expensive and dangerous illicit drugs, and that affects them in terms of affordability. That's why you'll find many of them wanting to steal from their communities, from their families, to feed the habit. So that was our position, and then there was the judgment, and the judgment, as you correctly say, Honorable Member, was decriminalization of use of cannabis in a private space, right? Growing of marijuana in a private space. And, because we're sort of convinced that marijuana is not only a bad drug. It can be good in terms of medicinal use as long as it is controlled, because the role of the CDA is control both the use and abuse of illicit drugs, like, marijuana now, also control the use and abuse of illicit drugs as well. So what can we say? The judgment is there. We have to rally around that judgment, make sure that people are aware of the judgment, because they need to understand what the judgment is. And people shouldn't think that because marijuana is now decriminalized. I beg your Chair? Sorry, Chair? Chair, we accept the judgment. Whether we like it or not is another thing. Who are we to go against the judges? Thank you, Chair.
Ms. Mayatula Khoza was saying we rallied. I would like to know who's that we. Thanks, Chair.
Thank you, Honorable Member. Honorable members would probably be aware that even the National Department of Social Development was against the Dacha couple. You remember the Dacha couple? And we is myself in my capacity in the past as the member of the Executive Council, together with it was Social Development Chair, so together with the people who are using and abusing drugs themselves, and mostly young males. So yes. Thank you.
Let's proceed, Honorable Gillian.
Thank you, Chairperson, and thank you, Ms. Khoza, for your honest answer. My last question is, during the COVID-19 pandemic, lockdown regulations were introduced which led to the ban of alcohol and tobacco sales in the country. How would you advise the country to deal with the sale of alcohol in particular during an epidemic in the future? Thank you.
Thank you very much, Honorable Member, and thank you very much, Chair. I think it was necessary, for our government to, at the beginning, lockdown level 5, level 4, to really ban the use of alcohol. You would have noticed that when it was opened, I can't remember which level it was, when it was opened, people were in long queues wanting to buy alcohol, and others abused, because alcohol is also a drug. It's okay if you drink it like occasionally and not excessively, but if you take it excessively and in large quantities, then it's a problem. So people's behaviors were really altered during that particular time. The gender-based violence escalated in many provinces because of the effects, of abuse of alcohol. And as time went on, our government opened up. People could buy from a particular day to a particular day, from a particular time to a particular time. And I think it was really well controlled. So I really think that government did what it had to do to really solve the problem, because this is the first time we experience COVID-19 in this manner in our country. The government was interested to save the lives of people, to ensure that there's no abuse of women and children in our country because of, abuse of alcohol and cigarette. Honorable Member, I don't know if you asked only about alcohol or you also asked about cigarettes, only alcohol. Yes, no, I think the government really tried its level best to control the usage, the sale of alcohol, even though we know that there are people who would sell it backdoor in the future. The advice in the future is really to strictly, control the sale of alcohol, especially to young teenagers and children should not be using alcohol, because especially we know that the growth of the brain, physical growth of physical growth of the brain happens mostly when people are children and when they are teenagers. So if they abuse alcohol at that stage, at a later stage, really, it's a big problem. So there should be better control measures by the law enforcement, reduce the taverns. Don't really, the board, the liquor board should not just be giving licenses and licenses to everybody who wants to have a tavern. But at the same time, the dilemma is that people earn a living from those particular taverns. So for me, it's about control, effective control. Thank you, Chair.
That's where our deal ends between us and yourself. Thank you very much for that conversation. Are there any questions you want to raise with us?
The questions I would be interested in, Chair, is the state of CDA as we speak right now. I know that you are in the process of getting members of the board. Their mandate ended long time ago. So is there a vacuum, or what is the state of CDA?
One can add, my understanding is that the members were also reduced, no longer the original number. And in terms of their work, the capacity demonstrated to be a huge challenge. Term long overdue. That's why we are pushing this, because COVID also disrupted us. That's why we're pushing now that once we're done with this, the minister appoints so that this structure is properly established to serve this historic challenge that is facing our country. Okay. Thank you. All right.
Thank you, Chair. Thank you, honorable members. Thank you, honorable members.
If you are driving to Joburg. I can tell you, last Friday we drove to Gauteng from here. Myself and Honorable Boyce Manel. We just felt we haven't driven for a long time. Let's just have a feel. It was amazing. We enjoyed it. Telling you. It was lovely. Just experience. We saw a lot of things we wouldn't have seen if we keep on flying. Yeah. Next, 7, 17, 25, 31, 38, 43, 49, 50, 5, 59, 60. Yeah.
From the
It's a very difficult thing to handle, that one. Let me tell you, Let's allow the, yeah, we'll discuss it later. How do you pronounce? Dr. Reverend? Nwamiloro. It means? The dreamer. Which, is it vendor? Yeah? Oh, Stonga. Yeah. Nwamiloro. Oh, from Ulora. Okay, all right. You know, black language is a... Oh, okay, I nearly dodged, eh? I nearly dodged. And I would say, I don't know this one. Nwamiloro Chawane. Mr. Chawane, can I take this opportunity to welcome you in this special session to engage us based on, on your CV that made us to shortlist you so that we can have this conversation and engage with you to sell yourself. Why should we consider you for this job? You are welcome, and we call upon you to feel free, comfortable, relax, listen to your answers, and so on. My name is Mondli Kungubele, the chair of the panel. Next.
Good afternoon. My name is Member Gillian. I'm the co-chair of this panel. Thank you.
Good afternoon, Fundis. My name is Kang Stock, member of the Portfolio Committee on Social Development. Thank you.
Good afternoon, Dr. Reverend. My name is Bridget Masango. I'm the member of the Portfolio Committee on Social Development and the subcommittee.
Good afternoon, Fundisi. My name is Letitia Aris. I'm a member of the Portfolio of Social Development.
Good afternoon, Mr. Tawani. And I'm Delmain Christians. I'm a member of the Select Committee as well as this committee.
Afternoon, my name is Otto Malika. I'm a member of the subcommittee.
I said the reverends are always ready because you don't know the day and the time. Okay. The conversation I'm going to have with you is going to be 3 minutes. But I always make sure that 2 minutes belongs to you and more seconds. If you tell us a bit about yourself and why you're interested in committing your time, energy to serve this board, and if appointed, what are you bringing? It's almost 3 minutes. Okay, proceed.
Is it on now? Yeah. I was born in Lady Selborne and brought up in Bushbuckridge in Pumalanga. My education started there. Immediately after, when I was doing my primary school, I was divorced. My parents divorced. And I found myself in the street, not because my father, we were poor, no, because of the divorce. I was in the street, I worked in the farm, and I tried all these, what other young people, smoking basin and other stuff that other young people will do. But because of my vision, I then went back to school, and I educated myself up to the highest standard in education. So the reason why I'm here, and after that, of course, I worked with I went to study theology in Alice at FETSEM next to Fort Hare. And there I met Steve Biko. He was our leader at that time in Sasso. And that was very helpful because that's where my intellectual and political foundation was started. And I came as a minister. In 1976, I became part of the leader in Soweto. 1976, when it started, I was part of that, and I interacted with young people. After that, I got a scholarship to go to study in America to start youth ministry. And immediately after coming back, the church then seconded me to go to the South African Council of Churches as a youth minister. That's where I got exposed to young people's interests. The reason why I became interested is because the drug issue is very permanent to young people, and I know what they are going through, and I've got a lot of those experiences I had. Okay.
The Central Drug Authority was established by an act of parliament. So we would like to know which act that is and what does the act seek to achieve? Thanks.
Okay. You mean the act in terms of the number? It was started in Act 70, I think, Act 70, if I can remember. But it was dealing with the issue of prevention, treatment, recovery, and of course, reintegration to the process of the community. Yeah. Yeah, the National Drug Master Plan is a very good framework. It gives a very good framework of addressing the issue of drug. The only, as you might have noticed, that the National Drug Work started in 2017, and it was reviewed, and finally it became they add up the issue. They thought it was weak in terms of monitoring and evaluation, and then they changed it. And it's a good document, but the only thing is that the implementation element is the weakest point of that document. And if that could be addressed, and I want to believe that the reason why people like ourselves are here was basically to come and add value, especially on the area of implementation plan. I come from the church, I come from the NGOs, and we have, I think, the grassroots the grassroots foundation that will help in terms of making sure that the national drug plan shouldn't just be planning from the top. It should also part of the bottom up, so that you have an organization like the one that we're coming for an interview here. It's the one that makes a spiral activity so that it touches both the top and the ground. So the input that one will make is basically on the element of money, of coming up with an implementation plan. But beside that, I think the weakness that we have, part of this plan, is that we tend to benchmark from outside. We have never really gone to the African approach. The reason why we have this problem is because the family breakdown, of course, the cultural element was not taken into consideration. And the reason why our young people are in the street is because the African values system was not strengthened. I'm talking about the values that we find in Ubuntu, philosophy of Ubuntu. Those are the value systems that we need to go back to. And another element, I think we need to begin to look at how the initiation school can play a role in making sure that our young people get values that are very, very important in supporting them and getting their identity. These are the areas that I thought will be appropriate. Coming from the faith-based organization, I think I can add value in terms of making sure that those components all come into play. Okay.
Thank you. The National Drug Master Plan 2019 to 2024 represent a multi-sectoral approach to create a South Africa free from harms associated with drug use, misuse, and abuse. The plan observes national and international policies, plans, and convention to ensure respect and dignity for all people in South Africa. So, my question to you, sir, is if you are appointed as a board member, you will be expected to implement the authority's mandate. Just share with us your understanding of the objectives of the National Drug Master Plan 2019 to 2024 and how you think the CDA should achieve them.
I think the objective of the master plan is part of those that we see in the social development. That is to make South Africa a drug-free country, and also to to support those who have been victims of the drug problem. So the role of the organization, the board that one is selected for, is to basically to assist the master plan, to assist the department in making sure that this program, the goal of both preventing, because there are a whole lot of program under the prevention, and of course the treatment element, and the area of recovery, and the area of rehabilitating those who have been victimized by this plague to come back to the community. But there are a lot of programs that need to be done on that area as well. These are programs that need to be followed by people who have got the right attitude, make sure that the people who have been victimized are not marginalized. And we need to make sure that they are free, and that our attitude towards them should be the good one. And of course, we need to add value that in organizations like Alcoholic Anonymous, where they allow those people who have been victims of this to become parties of the healing process, involve them. And of course, we need to add the element of benchmarking from other organizations that are dealing with the problem. The international element plays a very important role. I was privileged to go to Colombia to work with drug lords there, and I identified the programs that they are doing, and I think I can add value by going back to benchmarking from those organizations so that we empower our program.
Reverend, prior to the review of the National Drug Master Plan 2013-2017, a need to conduct an evaluation was prioritized to assess how it was implemented. Subsequently, the Department of Planning, Monitoring and Evaluation commissions the implementation evaluation of the National Drug Master Plan 2013-2017 as part of the National Evaluation System in partnership with the Department of Social Development. This evaluation took place between August 2015 and January 2016. What were the key findings and recommendations of the National Drug Master Plan 2013 to 2017, the implementation and the evaluation?
The recommendation, of course, as I said earlier on, was that the program was good, but basically it was weak in terms of implementation. And the other element, it lacks the administrative element, is that the board had there were a lot of people who were resigning from it. Either some people joined other organizations. So they felt that it was very important that they need to make sure that they re-establish a new board to begin to run this program, because that program will also help the department, which was the secretariat of the board, to operate, to make sure that the program is running smoothly.
Thank you very much, Mfundisi. I just wanted to find out from you, or maybe let me put it like this. Can you please share your understanding in terms of good governance? What its main features are, and what your level of understanding in relation to good governance is. And then also, if you get appointed, how are you going to ensure in the board that good governance is being practiced in the board? Thanks.
You need to know that you have been elected by the people. And then you need to be the servant of the people. And also that you need to put them at the center of everything. I think that's what Batupili is all about, that you need to put the people at the center of the governance. And they are the one who, time and again, you need to report to them so that they can also make an input as part of governance. Governance has to do with the will of the people. So, in leadership, when we speak about leadership, is that I think Martin Luther King put it very well when he defined what leadership is all about. He says, the ultimate measure of a man is not where he stands in the moment of comfort, or in the moment of convenience, but where he stands in times of challenge and controversy. You are there because you want to serve the people, not serving your own interest. So leadership is about influence. It's about influencing activities of both the individual and the group to achieve the goals that they have elected you to do. So, my understanding of governance is exactly that. You govern by the people for the interests of the people.
Thank you, Chairperson. Reverend Doctor, my question. What are the key issues affecting young people's families? Young people, families, wait, let me restart. What are the key issues affecting young people, families, and communities regarding drug, substance abuse? How would you advise the government to deal with these issues?
Hila, I come from the experience. I know what they are going through. The things that influence young people, broken families, the first thing. Once you lose the balance of the family, then you lose it. It's very important that the government need to take, we use at SCCC, we used to have what we call home and family life. And what you'll know that during the time of apartheid government, the African family was completely destroyed. The father was not there, was in the mine. The mother was the only one who was left behind to take care of the family. So the government need to make sure that they invest a lot in making sure that their families stand firm. So that when a young person loses that, he becomes a delinquent. And a delinquent, you know, I may not have even time to describe, but there are 4 levels of what delinquents. There are delinquents who are smart enough, who will go to drugs, but they will never go that further. There's those delinquents who will take Nyaupe, for instance. It's those young people are delinquent, who are completely far away from home. They are in the street. The street of Johannesburg is full of those young people. So these are kind of things that are influenced. But of course, the peer pressure is one of the most important aspects that really put young people to. The other thing is that we don't have recreational facilities where young people can be. You take the energy that they have. I always say the Lovu Youth Choir. It's a very good example where there were facilities. A lot of young people were arrested by that structure. Can you imagine if we have this kind of structures in the rural areas? young people are talented. Once they can have the place where they can take that energy, they can make a. So for me, that would be very critical. I'm saying so because I'm an artist. I attract a lot of young people through my artistic gift, music and so on. That's why I've got a lot of control for young people and influence for young people. I think that element, if you get into young people into artistic element, that will take them out of the street. In Nigeria, I worked with Nigerian youth. You hardly find young people in the street. They are in the farms, they are doing something. Here in South Africa, we need to benchmark from other areas where we can really get our young people busy and give them space where they can be artistic. I'm wounded. I'm a wounded healer. Yeah, I heal because I show them the wound. It's healing, but I can say, I feel what you're feeling.
Thank you, Chairperson. Baba Mfundisi, in your opinion, what is the state of public rehabilitation centers in the country? Are there any challenges with regard to access to public rehabilitation centers in South Africa? If yes, what are those challenges and how would you advise the country to address those challenges?
Yeah, the challenges that I've seen, I've worked with a number of them. The challenge that they have is the issue of capital finances, support. That's very critical. The other element is the element of training for the people running those institutions. And secondly, as I've said earlier on, we tend to be westernizing some of the institutions. We need to begin to go back, look to the root where we come from. I think if this institution can incorporate the African culture element, and as I said, the model initiation schools, where we can begin to inculcate values, African value system that will be able to take those young people through. And of course, after treatment, what happened? You need to make sure that you give them something that they can begin that they keep them busy and to close that space. Because when you treat somebody and they are, as our program says, part of rehabilitating these people, we need to give them substance. I think the state can add value into that. I can give you an example. In Nigeria, we trained the militants who were killing people. After when the government asked them to pull arms down, we trained them and they were given skill requisition. They went all over the world. The government, I think I can still remember, the government sponsored over 4 billion to give those young people skills. And some of them were here in South Africa, pilots and all of fishery and so on. They went back to Niger Delta. And now they are useful citizens of the country. I think this is what is a very good program that we also can benchmark.
Thank you, no problem. One of the challenges facing the country is a lack of comprehensive national statistics on the prevalence of substance and drug abuse. How can the CDA play a role in this regard?
I think we need to be very close, establish a relationship with the Statistics South Africa because they've got all the information that we need to do. And also we need to invite and engage researchers in humanities. Those are very critical people who can help us in terms of making sure that we have correct data and information on that element. We have all human resources in the country, just that we need to begin to engage them. And also we've got a lot of information that is not even utilized properly. I think we are comparatively, when we look at us and other parts of the African continent, even in the state, we are better off than the problem is that we don't utilize this information constructively so that it makes an impact in our lives.
Thank you very much, Reverend Swane. Recently, there has been much debate around the decriminalization of the use of cannabis or marijuana in South Africa by the courts. What is your opinion of that court judgment regarding the decriminalization of marijuana for personal use?
As indicated in the National Drug Master Plan, punitive approach has not succeeded. It has not succeeded in dealing with the issue of drug. I think what we need to do is basically, as I said earlier on, our approach to these people, the stigma element. And we will need to, as I said, I'm a wounded healer. When you go to these people, just judging them and undermining them and excluding them will not work. It's going there to them and say, I know what you're going through. Mahatma Gandhi said when he was approached by a mother with a son who wanted to stop eating salt, he sent them back for 30 days, for a month. And when they came back, they said, we're back. He said, now you can stop eating salt. He said, you should have told us a month ago. He said, no, I've tried 30 days not eating salt. And it works, so you can do it. So what I'm saying is that these young people who are victims of this, they want to hear from people who have been there before. They become midwives. I think what our young people need, they need young people who have been there, who have been part of what they are going through. And that approach is very critical. The approach is very, very critical for young people. And they are willing, they want to I was talking to some of them in the street of Johannesburg. And they said, we want to get out of this thing, but no one is really approaching us to help us in this. So I think that the wounded healer approach is very critical.
I'm healed. During the COVID-19 pandemic, lockdown regulations were introduced, which led to the ban of alcohol and tobacco sales in the country. How would you advise the country to deal with the sale of alcohol in particular during an epidemic in the future?
I think I want to approach our government. The stance that they took in dealing with the issue of alcohol was very constructive. And I think they should continue to do that. And this is a very serious problem because everywhere you go, our young people, I saw them just celebrating when the bottle stalls were open. And there was a lot of celebration. And this is a serious problem, Chairperson, that we need to deal and address as soon as possible. Our young people have been taken into this alcohol. And you go everywhere in the rural areas. Young girls are bragging there. I was looking at this song here, Jerusalem. When people were dancing, they were just dancing with bottles all over the country show. And I like the song. there's a lot of theology in the song where you look at the words, the lyrics, but I think what is important is that we are in serious problem when our young people taking over alcohol everywhere. It's not that, but South Africa, it's even worse here. I don't know what happened to us, but I think the state is very, I like the policies, what you're doing, the programs that we need, but you need to hook in with the faith-based organization and other NGOs so that we can strengthen each other and work together. Our advice? Yeah, the advice is that we need to do workshops. We need, like I'm saying, recreational centers where the healing can take place. We need to make sure that these young people, and also in schools, we need to have what I call second curriculum, where we deal with the issue. Because young people get into these things when they know the future is brighter. But if they see no future, they then begin to look at these things that give them temporary reliefs, and alcohol and drugs are the ones that normally give them temporary relief.
As I in the book. All right. It can't.
That's correct, sir. Good afternoon. Thank you.
Conversation with us. We invited you to be amongst the shortlisted candidates who gave CV that constituted the basis for us engaging you. And we have this conversation with you. We hope you'll be relaxed, calm, listen to yourself, fear none. All people who are here can't harm you in a mosquito. So you are in the safe house.
Thank you.
Just move on. Take your place. My name is Modi Mubele. I'll be chairing the panel. The father here? Stop. Yes. Co-chair is not here. It's the second time she's not here when we're doing. Oh, sorry.
Good afternoon, ma'am. How are you? I'm all right. Yeah, my name is Dikang Stock. I'm a member of the Portfolio Committee, also part of the subcommittee. Thank you.
Good afternoon, Ms. Smith. My name is Bridget Masango. I'm the member of the Portfolio Committee on Social Development and the member of this subcommittee. Welcome.
Thank you.
Good afternoon to you, lady. I'm Letitia Aris. I'm a member of the Social Development Portfolio.
Good afternoon, Ms. Smith. I'm Delmaine Christians. I'm a member of the Select Committee, Social Cluster, as well as a member of this subcommittee.
Good afternoon. My name is Otra Malika. I'm a member of a Select Health and Social Services and a member of the subcommittee.
Between myself and yourself will take about 3 minutes. But I'll give more than 2 minutes to you in that 3 minutes. So how you make use of it, the ball is in your court. If you tell us a bit about yourself and why are you interested in committing your time and energy to serve this board, and if appointed, what are you bringing in? Shoot.
Good afternoon, everyone. Yes, I'm a social worker. I graduated 1985 at University of the Western Cape, and I furthered my studies and did my master's at University of Cape Town. Okay, so I've been a social worker at Department of Social Development, Belleville office for 33 years, and 33. 33 since I graduated until 2018, and then I was appointed as director of SANCA Western Cape in August 2018. During my tenure at Social Development, I was responsible for the coordinating of various programs, including the 8 ministerial programs at that time. I was also the gender coordinator, and also I served on the strategic management of Belleville office, responsible for that 8 programs, so I had to give feedback to the management with regards to the activities and the progress of those 8 programs at the time. Currently, as director at SANCA, I'm responsible for ensuring that governance due diligence is being complied with. I need to ensure that the operations of the office is adhered to. I'm also responsible for the sustainability of the organization, so I need to apply for funding. Our biggest donor is Department of Social Development, so in essence, I'm still working for them. And then also Department of Health, they fund 2 posts of us as psychologist and the professional nurse. So SANCA is an organization that focuses on early intervention, prevention, aftercare, community-based services. We do training, we do programs at schools. We have different programs even for the young ones in creches that we call the Puppets program that is unique to SANCA. SANCA is an organization that exists now for 67 years. And at the time when we had engagements, they also had conversations with other stakeholders how to address the scourge of alcohol abuse at that time. So, and then there are now more than 33 centers, inpatient and outpatient patient centers of SANCA. So SANCA is also, we also do services for corporates as well, and training, so on all levels, for members of community, for professionals, etc. What we also do is drug testing as well. That is part of what we do. And yeah, I think that is basically.
Thank you, Chair. Ms. Smith, the Central Drug Authority was established by an Act of Parliament. We would like you to let us know which act that is and what does it seek to achieve. Thanks.
The CDA board was established by the currently Prevention of and Treatment for Substance Abuse Act 70 of 2008. And the CDA board is a statutory body that needs to ensure that the National Drug Master Plan that is stipulated in the Act, that is being implemented, adhered to. So the CDA must also make sure that the activities, programs, they facilitate programs and facilities with stakeholders, and they write a report. CDA is a national body, so it represents all the provinces in the country, and they must also ensure that all departments and stakeholders they develop implementation plans, action plans to address the scourge of alcohol and drug abuse. The CDA also needs to write a report that entails all the provinces' feedback. Progress is made, activities that was done, the achievements, what monitoring and evaluation was also done, and that report then is then submitted to Parliament. The CDA also needs to arrange a biannual summit, also to feed and share knowledge with all other stakeholders with regards to the scourge of substance abuse.
That's a conversation for 8 minutes, but 1 minute is already gone.
Yes, I would say what I found, when I was the coordinator, the program manager of the substance abuse sector at the time at Social Development. I also served in the Western Cape Substance Abuse Forum at the time. What I find is that the CDA is not very visible. And I know that is not their mandate, but in order for the departments to comply and to ensure that they do develop plans, that they deliver, that they form strategies for to address the problem, I would think that the presence of CDA needs to be felt more. The Western Cape Substance Abuse Forum, we are fortunate to have Chantal Peppers amongst our midst on the Substance Sector Forum. So we receive regular feedback from her on the activities and feedback and progress made on that forum. So what I also found during my tenure is that not all departments adhere to the stipulations of the Act to send representatives to serve on the local drug action committees. What I also found was the Department of Social Development is the leading department in addressing this problem, but the Act stipulates that the mayor needs to identify and select representatives to serve on the local drug action committees. I think Chantal has found quite a few challenges in that regard, in that some mayors do not adhere to that stipulation in the Act. So for me, it will actually be more effective if the Department of Social Development should have that role, as they are the department that addresses the social ill of alcohol and substance abuse. The monitoring, and therefore, because they are not always representatives of all the departments and organizations, there's not accountability. You don't find accountability. From my experience, Department of Justice never attended the local drug action committees. I established those during my tenure at Belleville office. And there were other stakeholders that were not available. They were not present when meetings were held. They were not presented at the Western Cape Substance Abuse Forum as well. How are they being held accountable according to the Act? So some measures, some forms need to be put in place for them to be held accountable for their plans. You know, they also need to develop plans, mini drug master plans, to feed into the report of the CDA. So we need all departments to address this issue. We can't work, the fact that we work in silos, that is also a bit very disturbing. The National Drug Master Plan is very plain, it's very clear on what is expected from each department, from each organization, from NGOs and all societies that are stipulated in the plan. So why are there some departments that do not adhere and account for what is stipulated in the plan? And I think if we have more active engagement with all departments, then we will be able to address the problem of alcohol and substance abuse on a more effective level. So, yeah, my thinking is that the CDA needs to be a bit more visible on provincial levels, on provincial platforms, to hear firsthand also the feedback that are given on that platform.
Ms. Smith, the National Drug Master Plan 2019 till 24 represent the multi-sectoral approach to create a South Africa free from harm associated with drug use, misuse, and abuse. The plan observes national and international policies, plans, and conventions to ensure respect and dignity for all people in South Africa. My question to you is, if you are appointed as a board member, you will be expected to implement the authority's mandate. Share with us your understanding of the objectives of the National Drug Master Plan 2019 till 2024, and how you think the CDA should achieve them.
Yes, I think I have alluded to some of those questions during my previous answer. What is very important is that on national level, there are different acts that guide the National Drug Master Plan. So there are about 22 acts, I think. So if those acts, people responsibility, if the sectors, if the sectors adhere to what that are stipulated in the acts, they implement their plans, they draw up the mini drug master plans, they feed into the I would say Western Cape Substance Abuse Forum because I am from the Western Cape. There will be much better understanding, there will be more cohesive, collaborative strategies that can be planned to succeed and to address the problem. Like if the Departments of Sports, Arts and Culture attend these meetings, we will be able to develop more and create more recreational activities for our youth. The biggest gap in our communities there are no recreational activities for the youth, for the communities. That is why they revert to using drugs and alcohol. There is no diversion, there's nothing else for them to do. Especially when we think of the rural areas, where some rural areas still make use of the DOP system. There's nothing else for them to adhere. And especially now with the youth that are using, is the increase in the use of cannabis by youth. What are all the departments doing to address that issue? What are they putting in place to inform the youth, to inform communities, to inform people about the consequences of using substances? And I think our approach should be the plan. A gap for me in the National Drug Master Plan is it focuses on demand reduction and supply reduction. This new plan does not speak to harm reduction, as the previous one did. And harm is the biggest factor when we speak about substance. When you use a substance, it does harm to you as the individual, to the families, and currently it's 17 persons more. We are experiencing an increase in mental health individuals. There are no resources where to refer those individuals to. And instead of having a punitive approach, we should rather focus on a public health approach to address the scourge of substance abuse, to minimize. And also, we should actually focus more, and especially Department of Education, where we have learners. Oh.
3.2. 2. Ms. Smith. Okay. Yes. Can I go? Oh.
Yes.
Oh.
Yeah, I would say at schools like creches, there is the platform where you have a bulk of youth, of learners, of children in one space at one time. So for our prevention and early intervention strategies, we should focus more on making them aware, educating them, empowering them about the harms of substance abuse. Yeah.
What is it? 4. Triple 2? So we're dealing with the 8 minutes. Right. Thank you, ma'am. Go to Trito. Question?
Ms. Smith, prior to the review of the National Drug Master Plan 2013 to 2017, a need to conduct an evaluation was prioritized to assess how it was implemented. Subsequently, the Department of Planning, Monitoring and Evaluation commissioned the implementation evaluation of the National Drug Master Plan 2013 to 2017 as part of the National Evaluation System in partnership with the Department of Social Development. This evaluation took place between August 2015 and January 2016. My question to you is, what were the key findings and recommendations of the National Drug Master Plan 2013 to 2017 implementation and evaluation? Thank you.
Yes, evaluation. Some of the key findings was, and I've alluded to that as well, that accountability is a major factor, and all departments does not account for what they address, the strategies that they must implement. Yeah, I must say I haven't reviewed the previous National Drug Master Plan as yet. But I should think maybe they found they must be they found the fact that the demand of and the supply of reduction is more imminent. That is the reason why the harm reduction was not included in the current National Drug Master Plan. And should we focus more on the demand, we will be able to address the problem in a more effective way on a preventative level, on early intervention level. The supply, substance abuse costs this country so much, billions actually, and that is what the Deputy Minister has also alluded to in the new plan. And in order to minimize that cost and the effect of that cost that it has on the country, alternative measures need to be put in place to reduce the supply of the plan.
Next, Ms. Garvin. Thank you.
Thank you. Thank you very much, Mrs. Smith. I would like to find out from you, what is your understanding of good governance? And then also, if it happens that you are appointed into the board, what is it that you are going to do to ensure that the board complies or also practices good governance? Thank you.
Yes, good governance. My understanding of good governance is that policies that are put in place, acts that are put in place, measures, any systems that are put in place needs to be adhered to, need to be complied with. That is also to measure, your objectives that you have set, does it meet that objectives? Accountability is very important when you think about governance. Policies are also there to structure any organization, any board, any company. That must be developed according to that specific organization itself. The CDA board, the governance, as I think my understanding is that all the tasks that is stipulated in the Act for the CDA needs to be measured, that needs to be adhered to, basically. And that is, the mini drug master plan is spoken about, that every department needs to develop. Is the is there a system in place that ensure that that is being done? How do you also hold the other stakeholders account? How do you account? How are they held accountable for not adhering to the act? So governance is basically having to see that all systems that are put in place to regulate or to operate an organization or board is adhered to.
Yes, thanks, Chairperson. The question is, what are the key issues affecting young people, families, communities regarding drug substance abuse, and how would you advise the government to deal with these issues?
Yes, key issues that affect our communities, especially the young people. Poverty for young ones. As I said, lack of resources, lack of recreational facilities, of activities, access to, especially now with the cannabis, the young people have more easy access to that. They are exposed to parents using the cannabis in their households currently. They are not aware of what the consequences, harmful consequences is of substances. The youth also don't have life skills to be able to manage that or to make informed decisions, healthy decisions. They are under pressure of peers, experimentation with the socialized, and the peers uses a certain drug, and especially in that young age, they are tempted to try in order to belong in the peers and sense of belonging. Then they start using then the substance. Of families, what we find now is parents lack guidance, they lack program of how do they manage these children of theirs that has a substance abuse problem. We are finding more and more the young ones presenting with mental health. And they are unsure how they should, they are not exposed, they do not receive the parenting skills to manage and to know where to take the child to for services. And that is also something that is lacking. The public out there, the communities out there are not aware of the referral pathways. The Department of Health had a planning session yesterday, and they spoke about a client, a patient that they had interviewed and intervened at. And these professionals didn't know where to refer the client to for his addiction problem. While there are so many organizations in the communities, but the communities are not aware, the public are not aware of, even organizations are not always aware of the referral pathways. Where do they access this treatment? Where do they send their clients for intervention? Lack of resources in the communities as well. There are such a lack of resources, especially for women. Are there facilities that caters for women with their children, with their babies?
Thank you, Chair. Ms. Smith, in your opinion, what is the state of public rehabilitation centers in the country? Are there any challenges with regard to access to public rehabilitation centers in South Africa? If yes, what are those challenges, and how would you advise the country to address those challenges?
Yes, that is a key factor. There is not sufficient treatment centers, especially inpatient treatment centers, for our clients. The ideal would be, the challenges also with that is the treatment centers, our individuals or persons who uses drugs that are from marginalized areas, they cannot afford these facilities. The ideal would be to have like a center specific where all the departments maybe are present. You have Department of Home Affairs, you have SASSA, Department of Social Development, Department of Health, etc., Department of Justice. Where should someone enter that facility, they will be able to access those stakeholders in one space. We should maybe also think of having a facility this facility treats like individuals who are dependent on the drugs, and they receive intense therapy, intense intervention. Then perhaps another center where they then revert to when they are kind of stable, they have undergone that treatment sessions. Another facility where they are being maintained, they are prepared for their lifestyle, for the lifestyles outside, for reintegration into society. And then from there, also life skills. Our people who are addicted to drugs, they have skills that are lost when they start using the drugs. Department of Education also, they don't complete their matric, and it's difficult for them then to find work. So then a facility, maybe a last facility where they are prepared for entering into the community again. Also the families to be involved in all those treatment programs, all that zones maybe, to skill them as well, to inform them, to prepare them for this new family member who will then enter or exit that last treatment facility. There is definitely a lack of treatment facilities and organizations in the country. And as I said, more specific facilities, and especially women. And youth, there was a center, Western Cape in East River, for the youth. That facility was closed down, but there was not another one made available for them. Where do we refer our youth to? They are so limited in referring our youth to for who needs inpatient treatment, intense treatment. Yes, that is just my thinking.
Ms. Smith, one of the challenges facing the country is the lack of comprehensive national statistics on the prevalence of substance and drug abuse. How can the CDA play a role in this regard?
Maybe that is definitely a lack. What is significant is the Sakendo statistics that is available. That also focuses on treatment centers, statistics. What about other organizations who are on the facilities who are not registered yet? Where do they feed their stats into? In what system? If the CDA can establish a clearinghouse where all this information about substance abuse are available. Also, for each province also, like a database of organizations that are available in each area. For us as stakeholders to feed into that, I had difficulty in inviting partners to Sanka National Conference next year. There were not sufficient data available of stakeholders in the sector. If we had the organization's name, there was no email address. We also need in this database, should it be established or developed, they need someone who will, keep it updated, keep it fresh. Should there are changes that takes place in an organization, that needs to be fed into that clearinghouse or into that system. And the system should also be available to the public. As at DSD, usually they have made available now another booklet like a substance abuse directory. But that is also outdated. That is also outdated. So and also for stats then also to feed into a system like that. We can use CGCIS. They are partners. They are also included in the National Drug Master Plan. So if they can be used to assist with that kind of database or clearinghouse, that will really have a bigger impact on us forming partnerships, making use of each other's resources, besides the local drug action committees. And that is on a higher level as well. The statistics will also then be able to feed into how do we direct our programs? Where do I direct our activities? Which area? Is there a hotspot? Like with the COVID now, there were hotspots identified. What hotspots are there in the area? We are not aware of those hotspots.
Thank you, Chairperson. Ms. Smith, recently there has been much debate around the decriminalization of the use of cannabis or marijuana in South Africa by the courts. What is your opinion of the court judgment regarding the decriminalization of marijuana for personal use?
Yes. At first, we in the sector were a bit angry, disappointed, disturbed that we were not consulted in that process. Hopefully the CDA was active with that process, or at least the provincial structures. My first thought was, you can now, how do you say it, in your achtergrond, you can plant it in your backyard, in your own home. What effect does that have on the children? My first thought was also, now, and again, the teachers are coming to fore. This teacher, before he goes to school, now takes a hit. He gets to school, and he is now under the influence of this cannabis, and he needs to teach their children. And these children, the learners, are also, some of them might also be, most of them, should most probably have also used cannabis because it is being sold on the school premises. In the long run, I think South Africa is not ready yet. My thinking is that in order to address the supply of say, cannabis, or substance in general, if all drugs can be decriminalized, and that we focus on the harm reduction more. So let us take the power away from those who supply the drugs. Cannabis, children, the learners have a misconception of that law that was made. They say that no, we can smoke dacha now because it's legal. They don't think of the consequences of that. There's a huge dropout at schools as well because of learners using cannabis. It affects the performance at schools. They are exposed to parents in the house using cannabis. They see the cannabis there on their property. It just what we should do with it is, the community, the learners especially, needs to be educated. They need to be educated, they need to be informed that although it is decriminalized, if you are caught with cannabis, a certain amount of cannabis in your possession, it is still a criminal act. You can still be criminally charged. communities need to be educated about that law that was promulgated.
Ms. Smith, my last question. During the COVID-19 pandemic, lockdown regulations were introduced which led to the ban of alcohol and tobacco sales in the country. How would you advise the country to deal with the sale of alcohol in particular during an epidemic in the future?
Yes, what transpired there is public started manipulating the situation by illegally selling alcohol. There are those who somehow or other found supply of alcohol and they sold it at exorbitant prices to those who needed that, who wanted alcohol. We should also think what was a bit concerning was the withdrawal symptoms of those who were addicted to alcohol. All the organizations were not available, not all, most of them. That impacted on the violence that they executed because they could not find alcohol to because the body needed that alcohol. What the country should do, it was rather a concern that normal citizens now became criminals. They thought that they were being criminals now because they were selling alcohol illegally and the tobacco as well, exorbitant prices. My thinking is, if alcohol can be, as it is currently done now, be limited to the hours that is being sold, put that kind of more stricter measures in place to not have alcohol available at all times. But it needs to be made available, especially for those who are dependent on that, who do not access services, who needs that for, as I said, the withdrawal symptoms, the tobacco as well. Smokers, and we find persons with addictions who they stop using this substance, heroin, cocaine, and then they substitute that with cigarettes. And that happens often. So not even tobacco were available for them. And that increased the violence, domestic violence in the country.
Your one advice on the future of alcohol in the country based on your experience?
Yes, my advice with in future that it should be made available, but under restricted hours as it is now. And not from Monday to Friday, maybe 3 days a week within certain hours. And perhaps restrict to not the strong alcohol. Whiskey and brandy, the spirits.
Right. Thank you, Ms. Smith, for your kind conversation with us. Do you have any questions you want to pose to the panel? Thank you very much. Yes?
Mike, yes, maybe a comment is that I have now drug master plan since the first one, 2003. The current one is such a bulky document. I'm just wondering, the master plan, yeah. It's such a bulky document, 132 pages. Is it being read by the important stakeholders, but those that are implicated and referred to in the plan? Is my question. Do they adhere to, if they don't read it, how can they adhere to that? And also, how can they be held accountable for, and it is also repetitive statements made in the plan. So if it can be made more reader-friendly, I think it will also help in getting more stakeholders on board.
It's a very, very important comment. Actually, that's a general disease of government. Government documents are very long. Something that takes 3 pages in the private sector, it takes 20 pages in government on something that can be said in 3 pages. I think it happens a lot when we accommodate mediocrity. That's a space. Government likes space for mediocrity, because in mediocrity, you write 17 pages before on the 18th page, you write what you wanted to write on the first page. All the 17 pages, you are still looking for what you want to write. Where mediocrity is allowed, such thick, there's no need for that document to be as thick as that. To be honest, but it is. And how long does it take to put it together? A year. When they revise it, how long does it take? Department, how long? I don't know. No. Your comment is very, very important. It's important for all government documents. It kills you before you read it. We read it because we don't have a choice. But otherwise, if you had a choice, you wouldn't read it. Thank you very much. Thank you very much, Ms. Smith. Can we release you? Can we release you with, we do not appoint, we nominate and submit to the minister. The minister takes the final phase of this process. Other details can only come through her way. Thank you very much. Thank you. Yeah. Don't disappear, Marcel. Honorable members, can you make sure that Marcel comes in? She must be here when if there are any closing remarks, whatever. Thank you. Honorable members, that's the, hey. Nenzani? Akuthatha usihlalo funeka nithule nje niqinise imihlathi. Molo. I'm talking now. You don't use your mouth, use your hands and collect documents. Colleagues, we end at that point for today. Are there any parting shots that members want to raise? So that anything that needs to be improved for tomorrow? I stick by my views that in future, Tabil, we just had this conversation. For this work, we need longer time, more spaced. I'm not disappointed with the conversations we're having with the candidate, But I want to tell you we can do better in terms of space and other things. People are not the same. You cater, there are people who say something for 4 minutes, which others can say in 1 minute, but the one who say it in 4 minutes, sometimes they've got better something to deliver than those who said it in 1 minute. So you need, your system must cater for all these different talents and predisposition and so on. Did I see your hand, Honorable Aris? Repeat that something because I think we need to have a very short conversation about it. Other members want to comment on that? Honorable Masang.
Chair, I don't know. I think we did not discuss this, even though Honorable Aris says that she wasn't part of the initial preparations. We didn't discuss that because I don't think we anticipated that it would happen. And I mean, it was a classic case of an open exam type thing. Yes. And you wonder if that's what we want to happen. Does it disadvantage those that didn't do that? So, yeah, I don't know. I don't know. It's a concern that maybe it doesn't need to be there, but yeah, because one wonders if it takes away from the candidate, but they didn't know. They were not told that they cannot do that. As a result, they did it, so.
I've got my own views on the matter, but let's hear, what is the rule, cousin? What is the rule? I accept it's a challenging issue, but where I'm sitting, there are people who prepare for interviews. Sometimes they can outsmart even the panel. I've seen people who outsmart the panel. Once they know the advert, they know probably what questions are going to come. They know it's not possible that the following questions are not going to be asked. And you're taking that one into account, the one you're speaking about. She's been a leader, an employer of many people. She's interviewed so many people in the same area. It's not unthinkable that somebody like that can prepare for this interview in a particular way. But the point I'm trying to make is that Honorable Masango says it would look like an open exam question. You know what is an open exam question? When you take a textbook, put it here, when a question is asked, you go to a certain page, you just answer the question. I think the fundamental piece is that part. Is it allowed? Where I come from as a teacher, I declared open exam questions because I took a view that science, for people to cram it is a very stupid thing, because what you want is not their memory, it's their understanding of the questions that you're asking. To me, a lot of people who produce 100% in science still want to fail it further, because what was being tested is not their knowledge. Most of the time when people don't have books, what you are testing is the memory, not the knowledge of the subject. So all I'm saying that I've got my own views, but I'm very careful about what you're saying, that let's be advised what's the best way so that people are uniformly treated, because what Honorable Aris is saying, he says, you don't know if somebody else understood that is allowed. They could have prepared themselves in the same way. Can we be advised? What is the rule? To be honest with me, I'm not worried about it as long as somebody was not copied.
Yes, Chair. This question, we once discussed it as a team, and we then spoke to Unati about it. His views were quite similar to yours, but I don't want to speak on his behalf. Because before he left here, he said if there's anything that we will need, we just have to let him know. So just to be cautious, I will ask that maybe tomorrow he may just quickly talk to it so that maybe he can give more clarity. But his position and understanding was very similar to your one, that these are the notes that the candidate has prepared.
The other things, Chair, I mean, if you mention things like the problem is if a person would have had questions. I mean, if you listened to the lady, she answered all the questions in her first 2 questions. So there's no way that she would have had questions, but we can't know that. So the lady that was using the tab. It was Ms. Maya Tulakoza.
Oh, no. Do you accept? Let's just get the advice legally tomorrow.
Okay.
Because let me tell you this. Nandi, if you know Nandi.
I do know her.
Nandi knows her talk.
I know her very well.
But however, if it's legally a problem, let's be advised. But it's quite a complex thing as well.
It's a principle,
Yeah. Thank you, Chair. Luckily, I don't know Nandi or any of these candidates that did come sit in front of us. I think even if we did get tomorrow a legal opinion on this, I think we did allow it for this first 2 candidates. We cannot stop the process from the others also. If any of the other candidates is coming with notes now, we cannot stop them from coming because we have already said that.